day and at the same time the last day of the second annual consortium meeting of Joint Action Implemental in Murcia. So today's first session is dedicated to sustainability. My name is Bernadette Bujovsky. I'm representing the National Directorate General for Hospital, which is the lead of the work package together with our affiliated entity, the Health Management Training Center within Semmelweis University, represented today by Zoltán Cserháti, Program Director, and we work together with our colleague partner, the dear colleagues from Trimbos Institute, represented today by Nina Boss, Project Manager and Scientific Expert. So, now that we have moved on to the implementation phase, it's very important that parallelly with the implementation of the determined activities, we take into account and consider sustainability issues too, in order to provide the, let's say, survival of the expected outcomes and results of your projects. In the past 2 days, we have seen that the topic of sustainability has naturally arisen during many sessions, which shows us that you find it relevant and you are already dealing with this issue. So for today, in the first part, we would like to provide you some information on what tasks we will have in the near future and what specific support you can expect from us. After that, we will have a short panel discussion where we will discuss how to sustain implementation with the participation of WHO and country coordinators of Joint Action Implemental. In the final part, as I'm sure that in these morning hours you are still fresh and relaxed, so we have prepared a little exercise for you, which I'm sure you will find very useful to start thinking about how to define goals regarding sustainability. We would like to ask you to fill out this little survey on how we can support you. We expect your suggestions. You can use the QR code or the link, so please feel free to fill out it anytime during the session. It will provide very useful information for us. So let's start, and now I would like to ask Nina and Zoltán to take the floor. Thank you.
Good morning, everybody. Bernadette already kindly introduced me. I'm Nina Boss from the Trimbos Institute. And right now, me and Zoltán will walk you through the plans that we have for sustainability activities in the remaining time of the project. We will do this using the Unified Conceptual Model, which is a model that we created based on literature and... Oh, there's no slides. I don't know if the technicians can... Yes, there we go. This is the Unified Conceptual Model that we created, and it's based on literature and also aligned with the implementation phases of the joint action to make it useful for this project. So it's basically a theoretical base to see how countries and where and when countries can do sustainability activities, and will specifically highlight the support from Work Package 4 in this. There is somewhat of a logical order in this model, but that doesn't mean it's fixed. Sustainability is something that happens from the start. We've been hearing that over the past few days as well. Yes, but I will just walk you through it, and Zoltán and I will highlight the specific Work Package 4 support. So let's start at the very, very beginning, and below you'll see the model in small with the arrow to indicate where we're at, just for your ID. I'm standing a bit awkwardly here. I'm a bit tall as well, I think. Oops. So starting at the start, which is actually pre-project phase, this is where the Belgian mental health reform and Supra were chosen to be taken into this joint action project. And yeah, won't go into much detail here, but good to point it out. And after this, the pre-implementation phase starts. We're all very aware of this phase. The countries have been doing a lot here, and we can also kind of see this as the foundational phase where a lot of base is set, like the implementing sites are chosen, the SANA is performed, the theory of change workshop was done to identify outcomes. So a lot of here sets the stage really for the rest of the project and the activities that countries are undertaking. Moving to the implementation phase, and that's where a lot of countries are now. Some have already started with actually implementing, some are yet to do it very soon. And the implementation phase is a phase where a lot of knowledge will arise. And this knowledge can mean implementation-based knowledge, knowledge from experience, from experts, but also knowledge from policymakers and other important stakeholders that are engaged in the project. I'm not going to walk through everything also because of time, and it's also good to mention that this is all written in a report, which is because it's a deliverable, it's on MDesk, so if you want to read the full report, you can find it there. And one of the things that Work Package 4 is supporting with regarding getting all this knowledge together is through thematic workshops. So thematic workshops for sustainability are basically used as a platform for a structured exchange between all the joint action implemental partners per best practice on a specific sustainability-related topic. This is also something that's been done in a lot of other projects. It's a very useful way to facilitate development of a network, which has also been highlighted how important it is to have an international network. And we can make the case for why mental health transformations are important now. So it's really a way to exchange and share learnings and experiences during the phase of implementation. Practically, when will they happen? We actually have the first one planned for the countries implementing Supra. This will happen on the 24th of October, and it's going to be on the support and acceptance of the draft or revised National Strategy for Suicide Prevention. I invited all the Work Package 4 contact points. If you didn't receive the invite yet as a country, please let me know, because then it will be good to have you there. And for the Belgian mental health reform, we have some initial ideas for a topic, but a date is yet to be confirmed. We do aim to have one by the end of this year as well, and we obviously have the rest of the project to organize any more if that's the wish. So going back to the model and the phases, we're still in the implementation phase. But now more on the translation part. So all these knowledge sources that I just mentioned, like the implementation-based knowledge, experience-based knowledge, etc., can be used to create a more specific view of what you want to do. So, for example, in the Belgian mental health reform, a roadmap will be developed. For Supra, the strategy is developed. And one of the things that Work Package 4 will do is develop a policy toolkit, that countries can use to their benefit. What is this, actually? So the policy toolkit is aimed to be a user-friendly policy toolkit to guide countries on how to proceed after the pilot, and especially promoting sustainable implementation. It's going to be quite an elaborate toolkit to help support taking the next steps in creating support, especially support from policymakers. And we want to tailor this policy toolkit as best as we can. So we're keen to use the lessons learned throughout implementation. And we've already heard a lot of lessons learned in the past 2 days, which are also very useful. I also sent out a table of contents a while ago. I received feedback from some countries, which was really helpful for us. So the aim is also to keep you involved in the process of creating this. Like I said, to tailor it as good as we can to make it as useful as possible. And the when says early 2024. More specifically, April. That's when we expect to finalize this. Okay, back to the model again. Still the implementation phase, but now a bit more on dissemination. And I think dissemination is like a lot of these phases are not fixed. Also, dissemination is something that's been happening obviously throughout the project. For example, with from the work package 2. Yeah, and countries are already very involved in undertaking activities with meetings with stakeholders. So dissemination in this case is something that countries themselves can really take up using the movement and the power of the Joint Action Project as well. And one of the main things that Work Package 4 is here to support you with are policy dialogues, and I will give the word to Zoltan to explain these in more detail.
Thank you, Nina. So let me continue with a quote from the briefing note of WHO. The term policy dialogue means different things for different people. And we use this term policy dialogue in different meaning, but do not worry, because that's quite usual as it is described in this document. For the policy dialogue activities, that's why we would like to differentiate the policy dialogue, the process around the policy dialogues, the policy dialogue sessions, which are described in the grant agreement of the joint action, and we also introduce a term, policy forums, which can cover international discussions like the linking practice to policy sessions yesterday. So the process itself is part of a policy-making or decision-making process, which contributes to develop or implement a policy change through consultations, discussions, workshops on a specific question, on a key question on a specific subject. The key subject in this case, the key subjects are the good practices. You can, and then we focus on the sessions which are part of the indicators of the joint action. That's why the project expects the countries to organize policy dialogue sessions around the topics. There are preparatory activities before the sessions, highlighted with green, highlighted with gray, with engaging the stakeholders and organizing the event. The event themselves and the follow-up with evaluation and with setting up the direction towards consensus. What we can offer you and what we expect from you, we will provide a guidance, a roadmap for the countries, and it will contain the definitions, the methodology, and tools for these policy dialogue sessions. And we also will circulate a questionnaire for the stakeholder forum members and the MSPC members. When you are about to receive the roadmap at the end of November, at the beginning of December, and following the implementation and following the project timeline, it's the best to organize these policy dialogue sessions between January and March next year.
Thank you, Zoltan. Well, we're nearly at the end of the model, the cycle, and we've entered the post-implementation phase. So post-implementation phase is the phase where you would like to see hopefully some uptake of the activities that have been implemented. And Work Package 4 will support this through a common sustainability plan, also including focusing on next adopters and for support. And again, Zoltan will tell you a bit more about this.
So we have a final task in Work Package 4. That's a common sustainability plan, which is expected at the end of the joint action. And this plan will serve for supporting the potential uptake for the joint action in the participating member states, in the non-participating member states, and at European and international level as well. It will contain the recommendations coming from the good practices implemented at national level, And also, we are counting for the recommendations from the Member State Policy Committee. It's scheduled to the end of the joint action, but it means that the last year of the joint action will also have a focus on collecting insights, inputs to this common sustainability plan.
And then the last bit is the post-project phase, and well, dreaming big and optimistic is institutionalization of these best practices. They've been embedded, policy is ensured, or the policy is changing along in a good way that's beneficial. Finance is secured. Obviously, big dreams, but why not dream big? Yeah, so we've ended the first part of this sustainability session, and now we're heading into the second one, and Zoltan will take over from here.
Thank you. I would like to invite Cassie Redlich from WHO and Alex and Matej to the floor. And we will conduct a short panel discussion, starting with a presentation from Cassie. I think, Cassie, you can... Okay, and let me introduce Cassie. Cassie Redlich is representing the WHO Regional Office for Europe. She's a technical officer who is working on the mental health across the life course topic, and she has a background with youth mental health service development. Cassie, the floor is yours.
Thank you so much. I just want to make sure you've got my slides. Brilliant. Good morning, everyone. It's a pleasure and a privilege to be here. It's been wonderful to listen to everyone and hear about the projects over the past few days. Our team have been so impressed by all the work. My role this morning is to set the scene a little bit. There's going to be a workshop later on and obviously the panel discussion. And so I wanted to just get us thinking and on the same page about what we're talking about when we're talking about sustainability, because I think similarly to policy dialogues, it means different things to different people, and obviously that's okay, because at different phases of a project, you do need to be thinking about different aspects of sustainability. Just to talk a little bit about the picture, just to clarify, does the whack-a-mole, everyone knows what that is? Yeah, okay, good. I think as I think about implementation and sustainability, increasingly I think it's a little bit like whack-a-mole, that we will be faced with challenges and barriers and threats popping up all over the place, and perhaps our task is to try and whack those challenges and barriers and threats on the head as soon as possible with whatever strategies we have available to us. So what are we talking about when we're talking about sustainability? Well, I think it's firstly a concept that includes both potential for sustainability, certainly at the front end of a project, we're thinking about potential for sustainability. How can we make sure that there's the greatest potential that this project or intervention can be sustained into the future? And we can do that by really boosting those known enabling factors for sustainability. We can make sure the program, the intervention is adaptable, and that we have a plan for evaluation, and that we have partnerships in place and all the stakeholders involved. But at a certain point down the track, we're thinking about actual sustainment of that thing that we're trying to implement. So we can start to measure, are we actually continuing to see change? What are the things that tell us that this thing is continuing to impact on the setting over time? We can think about it as the outcome of our efforts to enhance sustainability at the front end. And we can measure it in a whole lot of ways. So, is it about the level of uptake, this idea of embeddedness into a system or an organisation, the various ways that we see evidence of continued change is how we can measure this sustainment over time. I think we're also thinking about different things being sustained when we talk about sustainability. Sometimes we're just thinking about funding. Do we have continued financing? Do we have continued financial resources to keep this thing going? But other times we're talking about different things. So sometimes it's actually about sustaining those implementation strategies which will support the change process. So much more about, can we continue to train our healthcare workers in this new thing, because we know that there will be attrition over time. How will they continue to do something they haven't been trained in? So can we keep sustaining the strategies around the implementation of the thing? Sometimes it's really about a very concrete change in practice. Can we continue to get people to do things differently, whatever it is in their setting? And that could be quite static. Do we want them to do it over and over again in the same way with very high fidelity? Or is it that we want to see that the thing is changing and adapting to the context over time as the context changes? And sometimes we're just thinking about outcomes. So regardless of what is actually going on in the practice setting, can we see sustained outcomes or impact of those new practices or interventions, whether they be at the service level, the patient service user level, or at population outcome level? I think it's been interesting across the last few days to think about timelines. When we think about sustainability, are we talking about sustainability from the perspective of a year, 2 years, 5 years, or actually are we thinking about 20 years down the track? What will sustainability look like, and how do we continue to support sustainability and the adaptations and the different strategies that are required at those various time points? And we also are talking about the perspective of different actors, I think, that are either driving or have the potential to drive or block sustainability. There's a difference between the levers and mechanisms that are available to different people in different parts of the system. So we're thinking about sustainability from the perspective of policymakers, where perhaps it's more at a governance and financing level that the levers exist. When we get down to the health service level, I guess we're thinking much more about levers that include building motivation and buy-in and finding champions, monitoring and evaluating. And then also thinking, I think it's important to think about service users and the general public. They have great potential to either support or block implementation depending on what they actually like or need or want. And that will shift over time. The general public may like something now. In a shifting context, it might be irrelevant. And finally, we are always thinking about sustainability in the context of some quite strong underlying assumptions. Sometimes these are quite explicit, but other times not so much. And I think it's really important to think about, in the context of all these projects, what are the assumptions that we have about what will determine sustainability, and are they sound? And are they, if they're sound now, will they be sound in the years to come, or in 10 years' time, or in 20 years' time? So my question that I pose to all of us in considering this, and also for the panel members, is what do we think will really determine sustainability in the particular context that you're working in? So is it just about cost? If the program that you're implementing is cheap enough, will that be enough to determine its sustainability? If it costs too much, is that a sustainability killer? Effectiveness. If it's actually effective, if we can show this thing actually works to improve mental health outcomes at a population level, will that be enough to sustain it over time? Will it be taken up and embedded in health systems? Will it be about popularity, if people like it enough, regardless of whether it works or not, regardless of whether we see good outcomes? Is it all about politics? Is it other things? So I hope that that has got people thinking. I look forward to a really interesting discussion and also a workshop to come. Thank you.
Thank you very much, Cassie, for this comprehensive, thought-provoking overview. And then I would like to ask Alexander and Matej. You are deeply involved in implementing the good practices. So I would like to ask you to reflect on Kathy's thoughts. What will really determine sustainability in this context, maybe for the last question.
Of course, it's quite difficult to answer this question, but you sent me yesterday that you will ask me this question, and so I had one night time for thinking for at least what was maybe for Austria the important factors, and I want to grab out only maybe two of them. Of course, they are by far not the only one. One of those factors was mentioned yesterday very often. It is the broad stakeholder involvement. The more stakeholders are actively involved, the more there has been some kind of co-creation process, the more ownership exists among the stakeholders, the more there is the possibility that after political changes, after crisis, once again, all the people know about what it is about and will continue the work on that. So I think this is one relevant factor, and another relevant factor directly refers to Donald Trump. You never should refer to Donald Trump, I know. And actually, to be honest, the idea does not come from me, because it came from last week we had a conference on suicide, the World Conference on Suicide Prevention in Slovenia, and there was a guy from the American telephone helpline who was also part of the developer team of the American suicide prevention strategy, and he told us that Donald Trump was always afraid of the so-called deep state, and the deep state is the administrative forces in the second and third row. And actually, our experience, we now have 11 years of the Supra project in Austria. And in these 11 years, we had 8 ministers of health. So when it comes to sustainability and you only have the minister as your contact person, it is really a bit difficult. And Supra never has been the flagship project of one minister. So, and the driving force actually behind and the supporting force was the second and the third row in the administrative sector. On the one hand, Konstantin and Christina, maybe they're watching at the Ministry of Health, but also in the regions, that you have people there that are not replaced every second year. And this is, to my view, very important to have these people on board and to really collaborate with these people. And this is maybe one of another very important factor, especially for Austria. I cannot say if it's the same, but I think if it's the same in the United States, maybe it's the same all over the world.
Matej, is it the same in Slovenia?
Not exactly. I mean, we are slowly getting there, where we have the deep state working with us as well. But for us, it was more of a case of a policy entrepreneur, so someone who has a specific interest in the policy that we want to implement, and at the same time has access to the decision makers that matter and makes the policy or takes the policy to the forefront of the decision-making process. That was the case in Slovenia, but it's definitely not something that is sustainable or something that we should aspire to base our sustainability efforts on. But what really resonated with me is this realpolitik approach of, there's a theory of what we can plan in our sustainability plans, and then there's things that actually can affect them, and those can be quite simple, such as popularity or change in the political atmosphere or composition in the country. And there's a phase in policy making where we do put a lot of effort into checking all of these factors, and there's a lot of tools developed to be used for policy formation. And probably we could think about policy sustainment as a repeated policy formation process. I think that would be very helpful instead of having this sequential approach of pre-implementation, implementation, post-implementation. I think it reflects what really happens. It is better reflected if we think about it as a continuous policy formation, because things change quickly. We had COVID in Slovenia, we had floods. Those are major factors in terms of what is the political focus, where the problems lie, and all of this is hugely important to how a policy is implemented or not implemented. And having this flexibility of stepping a step back and once again taking all of the factors in account and adjusting what you're doing is, in my opinion, greatly contributing to the sustainability aspect of a policy.
Thank you very much. So you mentioned politics and the changes in politics, the deep state, the second, third row, and this policy and sustainment cycle. Cassie, from the perspective of the WHO, how can you see, you are working with a lot of countries?
Yeah, I mean, I think that both these responses ring very true. And, I think increasingly this idea of really meaningful stakeholder involvement. I think for a while people just said, that's one of the factors that improves the implementation and sustainability. But I think over time, actually, it's become quite a nuanced concept, and the way that countries are now thinking about how to really meaningfully engage and build buy-in and motivation amongst the key stakeholders who will have an influence on whether policy gets written and implemented and embedded and sustained over time. I think there's clearly increasing time and effort put into that process. And I think it makes good sense because there's so many impacts of that process. On a very practical level, I think we develop better, more relevant policy, and we develop better programs and services that are more acceptable to the people who will ultimately use them when we meaningfully engage people in the process of developing those things. But also it's the issue of ownership, and people feel like they've been involved. They're much more willing to support it. It's simple, and I think also there's an element of sort of fear of missing out, that people don't want to necessarily feel like they're behind. They want to keep up with what everyone else is doing. And so if you've got a whole lot of people, a whole lot of stakeholders in a room all saying the same thing, that this is what we want, we need this change, and this is what we want it to look like, and these are the principles that we want to underpin it, then it's hard to not be brought along in that process. So I think it's incredibly important, and that countries are doing it well, increasingly well. I also do think that the other, perhaps the slide missing from my presentation was on this idea of implementation and sustainability as a thing that stops ever. Obviously it doesn't stop, it's iterative and it's very dynamic, and I love hearing about, the contrast between projects that are just getting off the ground, implementing things for the first time, versus the experience in Italy, and thinking about 20 or 30 years and how the changes of implementing community-based care have changed over time. So, I think that that's incredibly important, that it's actually where we're always iterating and improving, hopefully, and that these aren't static processes that end.
Thank you. So never stop implementing and never stop improving. And thank you very much, Cassie, for bringing in the user perspective and the importance of the ownership at the user side. In the previous 2 days, we discussed different aspects of sustainability, stakeholder involvement, capacity building, communication, trainings, and so on. And there's another thing which is mentioned also earlier. That's money. That's the financing. So my question for Alex and Mate is, what has been a key facilitator for securing financing, or what have you foresee as a key facilitator, or does money matter so much, or not really?
Yeah.
What is the case?
Money matters a lot, yeah. Probably second most important thing. I would just highlight 2 things. First is do your own homework, as in, make sure you know what the sources of financing are, what is possible, what is available. Because there's plenty of sources for financing, especially in the field of mental health, suicide prevention, and we're missing out quite often if we just stick to, one office that we're familiar with. So that's the one thing, and then transparent communication with funders, whoever they are, on what your goals are, what your plans are, and also about what their goals and plans are, because sometimes we might be thinking of the same thing, but expressing it differently, and there is a great chance that actually a funding might be secured if we manage to explain what is being planned in a way that the funder understands and realizes it fits into their idea of where they're going as well. That would be the 2 things from my side.
Actually, it's also, I fully agree with what you're saying. I have not much to add on that. Maybe the only thing I have to add, it always depends a little bit from which perspective you're looking on it. I used to work for many years in NGOs and then changed to the National Public Health Institute, so now I'm more or less on the other side, I would say. And this makes a big difference. If you, when I used the NGOs, it was much harder actually to get fundings for the things you're doing. It was more difficult to convince people to give you money. This is from when you work for a National Public Health Institute and collaborate very closely. Actually, we're nearly part of the Ministry of Health. It's much easier, and I think it's always a question from perspective. And for us, it's so much easier. Quite now, this is maybe also when you're thinking where to organize the suicide prevention, or if you have a coordination center like in Austria, it was really a good idea to locate it at the National Public Health Institute and very close to the Ministry of Health. But this is, for a federal state like Austria, a good solution. It does not mean that this, for all the countries, the best solution.
Thank you very much. So you emphasize different perspectives. Sometimes we see what we implement from a technical perspective with the evidence-based solutions, and we trust on that, but there are other perspectives on the ministry side and on the funder side. So this was a mini panel, and I would like to hand it over to Cassie for some closing words and some messages or advice for the implementation team.
It feels like a lot of pressure, but I think reflecting on the issue of money and financing, and this is the question that we get asked the most. I think it's and it's the answer to the question of what are the greatest barriers to really driving reforms in mental health is that there's no money, we don't have money to do anything, so we can't do it. I mean, I think for us, it's we understand obviously that is an enormous challenge, and I think it's. Firstly, there's a few things. One, it's reflective of a lack of commitment, and so for us, it's almost the easier way of intervening is thinking about how do we support a country to build up commitment within government, and thinking about how, given the particular context of that country, what are going to be the levers that build commitment and motivation to invest properly in mental health and mental health reforms. And sometimes that needs to be quite creative, and it won't be the same in every country. But that's almost the first, the step back and think about the commitment. How do you actually gain that commitment, and then hopefully the money will come. The other thing that countries, when we talk to them and they talk about the stakeholders they get around the table, the sectors that are often not included are finance sector, and the ministries of finance are rarely on the list of key stakeholders that are being brought into discussions. And so it's another, I think, one way that we see we can support countries in trying to get the right sectors around the table where there might be different funding opportunities. But, just reflecting on the last few days, though, I can also see that there's a huge amount being done with small amounts of money and very much from a bottom-up approach. And that's incredibly inspiring and motivating, because I think a lot of big changes we know a lot of big changes and big reforms have come through that process of doing things at small scale, doing them well, doing them persistently, continuing over time and building slowly from the ground up and to the point where things do become sustainably funded and embedded. So I think the JA Implemental and all the projects that are going on at the moment, this work is incredibly important in showing us that there are many, many ways to go about building and sustaining change.
Thank you very much. So it's easier if we have high-level commitment and just keep on going in a sustainable way from the ground up to the higher levels. Thank you very much for participating, Cassie, Matej, and Alex. And I hand it over to Nina and Betty.
I hope you enjoyed this panel session and found it inspirational and a bit thought-provoking already. I certainly did, and I think if the next bit that we have planned for now follows up really nicely with what has been discussed so far. This won't be so much me talking to you. We actually wanted to do a little sort of exercise, thinking about sustainable goal setting. Because, well, we've heard in the past few days implementation is challenging, and inherently trying to sustain the implementation is also very challenging. We've heard a lot of barriers mentioned already in the past few days. Also, at the start of the project, we asked countries, what do you think will be barriers? Well, a few have been, I wrote down on the slide. For Supra was, for example, mentioned organizational leaders are not familiar with the importance of mental health, insufficient workforce and staff, stigma, election cycle. The countries implementing Belgian mental health reform, for example, mentioned limited intersectoral collaboration, understaffing, political instability, stigma, lack of monitoring and evaluation. So these could be potential killers of sustainability. The idea of the exercise is for countries to think about this concept of sustainability killers. It sounds a bit thought-provoking. That's also the reason to use this word. And use these insights that you have to translate these to realistic sustainability goals. This will not only be useful for your own sustainability efforts and activities that you have planned. It's also really useful for us as Work Package 4 to understand these so we can tailor our support better as well. But first things first. Well, actually, one I haven't written down here. I think everybody received a template at the, yeah, okay, good. If you are a country that implements both best practices, choose one or divide it between teammates if possible. This is also, there are a few like time practicalities we had to take into account for this exercise. So this is the first bit. Then we'd like to ask you to pull up either your theory of changes and look at the outcome levels that are in there. But you can also use your pilot action plan and look at the expected outcomes that you've written down there for your country's implementation. Maybe they're in your poster or they're in your presentations that you did. Because either one of these will kind of function as the base for the exercise. If you are online, I don't know if maybe Faith can, or somebody can tell me if there are people online. I think it might be easiest because I understand it's a YouTube channel, so I don't know if we can drop the template there. If not, please write your email address, and then I think Faith will try to manage to send you the template. So you can also do it online. And if you're with your team for some reason, if you're in the office, you can gather, but otherwise we encourage you to do it individually. If you do not implement, we think it's still worthwhile for you to think along and try to do the exercise with country teams or for your own situation. This is the part about the piece of paper. So what are we actually asking you to do in this exercise? So we ask you to select one outcome from either your theory of changes or your action plans. I think a lot of you have way more than one outcome, so it's not feasible to go through all of these. And we want you to think about the three following questions. So that's, what in your country's context is a possible sustainability killer or killers in relation to the chosen outcome goal? Looking at post-joint action. And how does this killer impact the desired goal that you actually want to sustain, that you're putting your energy and efforts in during this project? And what is needed to then mitigate this impact? And a few ways to think about this could be motivation, resources, capacity. Just to make it a bit more clear, I prepared a fictive example. Maybe it's not, it could be real, to just walk you through the idea a bit more. So let's say the outcome you select is peer workers are paid members of all community mental health teams in the region. Stigma could be a potential killer, maybe stigma also among professionals. And legislation causes difficulties to secure the payment because, for example, I remember Antonella saying it can interfere with social benefits. So what could this mean? This could mean that maybe only in some of the teams there is a peer worker that's part of the team, or maybe some of them are paid and some of them are not, and it's not really looking at the outcome you envisioned. Then we'd like to think you about what is needed to mitigate this impact, and we thought it might be nice to think about this on two separate levels. The first being looking at the minimum level. What at the minimum level do you need to mitigate the impact of these killers somewhat? So looking at motivation, that, for example, could be health professionals and peers or peer-led organizations meet twice a year to discuss possibilities and wishes and maybe set up a plan. Resources might be coming in from project-based resources to implement these peer workers. But we can also look and dream a little bit bigger for an ideal situation. The motivation could then be a formalized collaboration between hospitals and peer-led organizations. Resources mean legislation allows peer workers to be a paid member. And yeah, we hope this exercise will help you think a bit more about what potential killers are there, and what do we need to think about if we want to, well, mitigate this. So yeah, please go ahead. You can also go to the Ola to do it. Let's say we have around 30 minutes to do this. Get as far as you can. We will be walking around, and let's try to get back 5 to, what should I say, 10:25 or something, or 10:20. And if you have questions, also please ask. Hello? Yes. Oops. All right, let me just... I asked everybody who was out back to come back, so I hope most of you are here. Wait, is it working? Yeah? Okay, so I can't hear it correctly. So we won't spend too much time now to fully have a discussion on the things you have been writing down. However, oh, not good. Oh. Another one? Oh.
1, 2. No? Yes? That one? No?
I'll just, hello? The sound is bad, isn't it? Hello? 1, 2, 3, test, test, test. They're working hard out there. Yeah, true. Now I feel like I'm put on the stage, which I am. Hello? No, I don't think it's Is it working? It's vaguely work. Felix is asking me to do a little song, but I'm not going to do that. Is this one better? No. Okay. Yes. No. Okay, well, maybe I'll just do it without, because... Would you rather me go on like this, or just speak without a microphone? Okay. Okay. So... Yeah. I don't know if they'll hear me with this one.
Sí, sí, hola, hola, sí, 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 hola, 1, 1, 1, 2, 1, 2, hola, 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 sí, sí. Sí, hola, 1, 1, 1, 1, 1. Sí, sí, hola, 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 1, 1. Sí, hola, hola, 1, 1. Sí, 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 hola, hola, 1, 1. Sí, 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 hola, hola. Sí, 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 sí. Sí, sí, 1, 1. Sí, 1, 1, 1, 2. Sí, sí, hola. Sí, sí. Hola, hola, sí, ahora, sí. Hola, hola. Hola, 1, 1, 1. Sube. Sí, sí. Hola, hola, sí, sí. Sí, hola, 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 sí. 1. Vale, parece que ahora sí. Parece que ahora sí.
All right, the show can go on. So we don't have a lot of time left anymore because we actually are a minute over time. But I hope this exercise was a good start to think a bit more in a detailed way about, well, the killers. We as Work Package 4 would definitely like to follow up on this in the months to come. I don't know if I don't really know if we have time for questions, but maybe someone has a quick question. No? All right. Then I'll give the last few words to close the session to Bernadette.
As this is the first session and we have already suffered a little delay, I would just like to thank you for all your attention and the participation in the exercise, and get prepared because we will start the hard work soon. Thank you very much.
I would like to remind you that today is the last day, so many of you will leave. So we need to check on time. So we will start 10:45 sharp in order to have time for the 3 meetings that are scheduled to that most of you are leaving. Thank you. Not most of you here, because the faces I see here will stay. We will see, but most of them are online. Only 2 are on site, and from what I see, only 1 here. The rest are online, and they have confirmed that they will be. So I think all 10, all 9, if Hami is here. Daniela? Anyone from the Croatian team?
Everyone, do you hear me? Okay. We just, for the start of this stakeholder forum, want to check with our technical Spanish team who we have online. Can we get any picture from our panelists who are at this stakeholder forum for now? Can we see it? Okay, I can see Renee Keith. Here are Lara Grosso, yes. And we have, okay, Lushka. Okay. So we have 3 our online panelists here, and with us here on site are Lady Alazeri from World Health Organization and John Sanders from EUFAMI. Introductory presentation will be given by our Vasilea Conte.
Most so that we can stay on time. Thank you all for being here, and most of all, I would like to thank our panelists for today, those online already introduced by Danielle and those on site, for being here to share with us their expertise and their views on GA Implemental. Just a quick recap for all our panelists on the work of GA Implementa, who focuses on the transfer and pilot implementations of core elements selected by countries from 2 best practices: the Belgian best practice on mental health system reform on the community, and we have 14 countries participating on these 11 pilots across Europe. And our pilots on the Austrian best practice on suicide prevention. We have 17 countries participating on this and 14 pilots across Europe. The main objectives of GA Implemental, to remind, is to support member states to improve and promote mental health via innovative and sustainable mental health system change, to reinforce the capacity to address system transformation, to support and the transfer and pilot implementation of these 2 best practices, to achieve a strong involvement of national and regional governments actors to enable such best practices to be embedded in the health system, and to establish systematic and sustained collaboration across the variety of stakeholder forum members, and to share not only on European level that we are here to discuss, but also on national level, and to share a common vision for about mental health. So we have 2 advisory bodies, and the advisory body here on Stakeholder Forum is to contribute to GA Implemental progress, to bring in the views of our stakeholders, their interests and expectations, and to disseminate the GA Implemental scope, vision and results in further, not only the 21 countries, but even further. And we have nominated points that I will show you. We have, I'm missing a slide, but our stakeholder forum has a variety of European key stakeholders: EUFAMI, EASP, EUCOMS, INUSP, and Gamian Europe, Mental Health Europe, EuroHealthNet, And if I forget someone, because I'm missing a slide, I'm sorry. And of course, the international organizations, WHO, Europe, and OECD are here with us. From the stakeholder forum back in Zagreb last October, we had strong messages received, and we have tried very much to accommodate them and embed them in our system, that the good practices are important, but they are embedded in a specific national ecosystem. So we need to not to replicate them as such, but we need to ensure prerequisites are in place, legal framework, budgetary allocation, to have a strong political drive and a set time frame take into account necessary time for change to happen, an average 10 years. So we had this vision and that guidance to us that this will take a long time 1 year ago. I mean, for us that we realize it now, the message was clear from our stakeholder forum just 1 year ago. More involvement of beneficiaries, patients, families, professionals, decision makers in co-creation of good best practice package, because all have their perspective on co-construction process. Putting the patient person at the center by embracing human rights framework, putting community at the center, highlighting the need to establish a common understanding of what community-based services are and how they can best deliver the care service, use existing developed tools and training to assist and support the implementable network, strong focus on social inequalities in health, and improving the underlying determinants of people's health. Support beyond basic mental health care is often lacking. A strong focus must be on prevention with individuals, families, and on workplace. Solutions need to come from interministerial coordination. Ministry of Health need to liaise efficiently with the government sectors beyond healthcare. For example, education, social welfare, housing, environment, enterprise, justice, and of course finance, missing here, but often then we have addressed this. Mental health services should be effective, efficient, timely, localized, delivered to the right person at the right time in the right place, and keep strengthening the GE Implementer advocacy platform to accompany the change at national and European levels. So where we are now, we have developed our pilot action plans. We have shown these 2 days our pilots, our country efforts, where we are, and we are moving to implementation. We have 17, what we are expecting with our pilot action plans, 17 new updated or reviewed suicide prevention strategies across Europe, 14 community-based mental health system programs, activities introduced and planned for the future. We have more than 129 activities to be implemented the next year within the Belgium best practice, and more than 140 activities on suicide prevention, including awareness raising, support and treatment, coordination and organization, quality assurance, expertise and databases, restriction of access to MIS, and further embedded of suicide prevention in general prevention and health promotion activities. Main challenges: resistance to change, engagement of stakeholders, sustainability of funding and resources, availability of reliable data, shortage of mental health staff, where some of the main points and challenges and solutions were provided during these days by our country team members. Main positive outcomes: improving collaboration with stakeholders, management tools and methods can be extended to other regions and sites, community-based services developed and improvement, quick wins. Main lessons learned during these 2 years: customization to local needs is crucial for success of implementation. Interprofessional, intersectoral collaboration is key to successful implementation. A realistic action plan must be designed based on activities which are focused, feasible, and practical. The main goals and gains of G-Implemental Network: sharing experiences, knowledge increase, strong international network, and opportunity for change. With this concluding, I think we also need to see that our G-Implementa also is linked with the objectives of the EU communication on comprehensive approach to mental health, integrate mental health across policies, promoting good mental health prevention, early intervention for mental health problems, boosting mental health of children and adolescents, helping those most in need, reinforcing mental health systems and improving access to treatment and care, breaking stigma, fostering mental health globally. So we are here, and of course we need evaluation in order to move forward. Here are our stakeholder forum meeting that, from what Daniela, my co-chair, has checked, most of them are already linked. And we have the 4 questions. I give the floor to Daniela to introduce and to
Thank you.
continue.
So you all can see our questions. What do you see as key gains of Joint Action Implemental Network? What is your advice on the 3rd year of the project implementation? What are the synergies between Joint Action Implemental and your activities? And how can you support us on sustainability and scale up of Joint Action Implemental results? So stakeholders are here to push us forward, to make a progress, and also to advise us. So how do you see, what are your answers to those questions? To online participants, okay, I think to start with World Health Organization. So I can call Lara Grosso, EPA, if she's here. Do we
Yes,
have?
I am. Can you hear me?
Yeah, we can hear you. Okay, how do you see, how
Yes.
can you answer to those questions, please?
Okay, I will just make a brief introduction about myself and the European Psychiatric Association for those who don't know, the EPA. First of all, I just wanted to thank you for inviting me and the EPA to contribute to this stakeholder forum meeting. I'm Lara Grosso Sategna. I work as a scientific and policy officer at the European Psychiatric Association, which is the main association representing psychiatrists in Europe. Since its establishment, DPA has been working towards the improvement of care for people with mental disorders, as well as on the development of professional excellence for psychiatrists. DPA has both individual members and 44 national psychiatric associations members. We have 21 independent scientific sections that work on specific areas of psychiatry. In terms of positive gains of this project, I was able to attend a few sessions in the past 3 days online. And I have to say that for me, the fact that this project represents a platform for sharing best practices is very important, being mindful of the fact that best practices comes from different contexts, as this was mentioned, so being mindful of the differences and the different contexts that these practices apply to. I think that it's very important to take advantage of existing knowledge. At DPA, we have many initiatives and projects to understand the needs, especially of mental health care professionals, and what are the gaps that needs to be filled in this area. So we think that it would be an advantage to take care of this knowledge that is already there, but also to foster co-creation and involve stakeholders from the early beginning. And this implies, of course, collaboration and interdisciplinarity, which are key. And then another point that I would mention is the fact that it is important to consider, of course, monitoring and evaluation when changes are produced. So this is also something that I wanted to mention, and that's my reply to the first question, I think. So that's it. We don't seem to hear you anymore. Sorry.
Sorry, what do you see? You hear me now?
Yes. I
What
do.
do you see as a key gains of Joint Action Implemental Network?
Yes, I think the fact that this is a platform for sharing best practices, I think it's key. This is a positive gain. The fact that stakeholders are involved and that knowledge is produced through this exchange.
Thank you. So the second question, what is your advice on the third year of the project implementation? What should be done better?
Yes, I think it's already something that is being produced by the project, so keep involving stakeholders. This is key and important. As I said, monitoring and evaluating, that's also important, but you mentioned it in the presentation before. So these are the recommendations that I must give. Yeah.
Thank you. The third question, what are the synergies between Joint Action Implemental and your activities?
So yes, we see many synergies between the project and what we do at the EPA. We are currently focusing on many aspects that were covered in the past few days, as we are covering improving prevention and early detection of mental disorders, addressing the gaps in the mental health workforce, which means for us addressing the issues of shortages in the mental health workforce, harmonized training standards for psychiatrists in our case, and encourage meaningful collaboration with other healthcare professionals, with patients and families as well. We have, as I said, several initiatives in place to kind of cover this aspect at the EPA. We are also seeing synergies on reducing stigma on mental disorders, promote a patient-centered approach, and create a favorable environment for research. So we definitely see an alignment with these priorities and with the activities that we already do at the EPA.
Thank you. And the last question for you, how you can support us on sustainability and scale up of Joint Action Implemental?
Yes, we are already grateful to be here to provide our input today, and we will be happy to do so in the future, so to contribute to the project in this sense. But also we have, as I said at the beginning, a network of professionals, and we might leverage on that. So we would be happy, for example, to share any relevant news or achievements of the project through our communication channels to make sure that our network is also informed of the project's achievement.
Thank you very much. Stay with us, Lara. And now I will ask Lushka from Mental Health Europe to give us a short presentation and answer to these 4 questions, please.
Thank you for giving me the floor. Very quickly about Mental Health Europe, we are the largest independent network in Europe working towards the promotion of positive mental health, prevention of mental health issues and psychosocial disabilities. We are present in more than 30 European countries, and our membership is quite diverse in that we bring together in our platform service providers, NGOs, people with lived experience and their supporters, academics, and human rights activists. I will probably echo a lot of what my colleague from EPA said, because in terms of gains, I think the experience you have been and will be collecting will prove beneficial for other contexts within countries as well as for other countries in the EU. So my advice would be to really document very well the challenges, barriers, facilitators for you to implement these two key practices so that others can learn from your experience, and also to make the outcomes, deliverables, and tools you produce really accessible in terms of how other entities can use them in practice. I think in terms of synergy, the other piece of advice would also be to maintain those recommendations that the stakeholders shared at the previous meeting, because they remain relevant. And so the advice would be to be consistent in looking at those and making efforts to address them. In terms of synergies, well, we have a wide network, so I think what the joint action is doing will be relevant to many of our members, as well as partners and allies we work with, and so also linked to sustainability and how we can support. A big part of our role is, facilitating knowledge sharing, practice sharing, identifying good practices and disseminating them. So we definitely have a role in sharing, knowledge, learning tools developed by the joint action in many different channels and platforms we are present. We look forward to seeing the next steps of implementation, but also on a reflection on how the results of the joint action can feed into the next one, and can also feed into further steps next to the communication on a comprehensive approach to mental health. And an advice which is probably more targeted to the European Commission is to look at a longer-term approach for joint actions, because 3 years is a very short time for such ambitious plans. So I think you have been really doing a lot in such a short time. But I think a reflection on, having more time to implement, learn, pilot, and adjust and improve would benefit future actions. Thank you.
Thank you very much. Stay with us, please. And it is my special pleasure to introduce here René Keith.
Thank you, Daniela. I hope the connection is good, that you can hear me.
Hi, hello.
Oh.
I'm so sorry.
Oh, sorry, I heard my name.
Hello. Who is with us? Yes, René is here, but we have another. Oh, Thomas is here also. Yeah, I can see.
Yes, hello.
Hello. So I already introduced René Keith from EUCOMS. He will address first and try to answer to those questions, and then Thomas. René, here you are, please.
Okay, so I'm now. It's my turn now, and not Thomas. Yeah. Okay. Well, thank you very much for the invitation, and congrats with all the success you are already making with Joint Action Implemental. Really quite impressive to see. I've been replaced in the last days by my fellow board member of EUCOMS, Junella Petria, but I'm happy to be here today. EUCOMS is an international community of practice of mental health services across Europe, but also beyond. We also have connection to USA and Japan, Hong Kong. But most of our participants are in Europe, and we want to learn from each other practice. So we want to learn from each other the things that you cannot find in a book, you cannot find in a journal, you can only find it in our practice. So in fact, that's exactly what EUCOMS does. We have shared values. We base our service upon human rights, upon the importance of public health approach, evidence-based practices, the recovery approach based on goals, talents, and strengths of our clients, a network approach, and the lived experience as an independent resource next to practice and science. We have participants across Europe, going all the way from Norway to Portugal and from Ireland to the Republic of Moldova. recently also many contacts with development in Ukraine. And we meet in webinars 4 times per year at least. The next one will be November 29, and everyone's welcome to join our webinars. The next one will be on e-community mental health, so the digital possibilities that we can help us to support, to develop community mental health. And we have many partners, also network partners in that. And we have a meeting in next year, March, in Cologne. And if you want to join that, then please contact me. Then about the 4 questions, I think excellent questions. And what I really like about GA Implemental, it is my experience, the first really structured experience of adopting a good practice. In fact, 2 practices that involve that are involved and that can really support all these countries. And I think it's really good that you give the stakeholders like EUCOMS is a place in this forum. So that for me is really a very strong gain. If you also asked me for advice on the 3rd year, and I think my main advice is really to focus even more on the impact of what you do. Because you see 2 things happening. It's about sharing knowledge and it's about the practice. I would really encourage the last one, because only knowledge is not gonna help us enough. And there are many ways to get knowledge. You know, you don't have to travel for knowledge. So use the opportunity of meeting each other. And of course, meetings can also take place online, by the way. So much more exchange in that, because that also can prepare you for the future after GA Implemental. So be proactive in that. And you had a question about synergies with the activities of EUCOMS, and I will be happy to explore that further with you. And of course, I'm very happy that Daniela Stimac, well, in fact, I know all of you on stage, but I want now to focus on Daniela Stimac. She is also the ambassador of EUCOMS in Croatia. So I know many of the countries involved in this project, but I think Croatia is a very good example. We've another way already worked in Croatia, supporting the development of community mental health there. And I really think it's a very good example of a relatively small country that uses the joint action to reinforce what's already going on in the mental health reform in Croatia. And as we're also active in Croatia and having Daniela and also the contact with Martina Kuzman, I think we could use that as an example to strengthen each other, because our approach for the EUCOMS way of meeting, sharing the practical knowledge and skills and attitudes. So I would like to explore how we can strengthen that, and that would be a great example of a synergy, and that also could be in fact a way leading to my feedback on your 4th question, how to support the sustainability. The EUCOMS way of meeting is that we do these on-location meetings, and we do it 2 times per year. Last week we met in Leuven in Belgium, next year March in Cologne, next year October in Portugal, and then spring 25 in Greece. So use these meetings to get together and not just tell each other stories. It's very important, you know, humankind is a storytelling species, but very important to really show your practices and join that and be part of it and show also the struggle. We're all struggling. The development of community mental health has never in any place been easy. And often you think, oh, it's lack of resources. It's not that, because I think some middle-income countries have the potential of building a better integrated service than some of the high-income countries, because what we do in the high-income countries, we use our resources for a very fragmented system. So make it a bi-directional learning. So not that when I go to another country, I don't come just to send my own message, also come there to learn and bring things home. So use the practical and keep on meeting each other, and that we can organize, and that in fact that we can also organize together. I'm happy to explore that further with you. I'm really glad that, in spite of it had to be replaced, that I can be here today with you, and of course happy to take any questions on that. So thank you very much.
Thank you, René, very much. And now we can go to Thomas. Can you give us a short presentation and answer to those 4 questions, please?
Sure. Thank you, Dani. It's great to be with you here online, and I hope you enjoy your time in Spain for those who are there. I'm here as the representative of the International Association for Suicide Prevention, where I'm one of the vice presidents, and I'm also the coordinator of the European region of Partnerships for Life, which is the ISP program, which really has a lot of parallels to Implemental. It's the signature program from ISP to establish a cross-regional collaboration of experts supporting a comprehensive and strategic approach to suicide prevention. So obviously a lot of synergies possible here, and I would like to take up what really René said in his presentation, which is about sustainability. I really congratulate you on doing this work in your regions and countries, and I see it really as a boost to suicide prevention in those participating countries, really looking at quick wins, which it has been also in Austria very worthwhile to do, and very meaningful also to make a start. But of course, as we all know, it's really about sustainability, and suicide prevention is really very small step forwards, and it takes a lot of time and also energy and patience. And it takes a network, and I think that's one of the most important things that you have created here. You have created a network of people, a network of organizations working towards a strategic approach to implementation. So I think that is extremely useful and very helpful. And when it comes to the key gains, I think that's exactly what it is. Now, the issue obviously is, like any projects, it does have the end date, and that end date is actually pretty soon in 2024, as I've heard. So the question really is, what about after 2024, what to do about the progress made here, how to keep it alive, how to make the adaptations necessary, because there is really little that is set in stone when it comes to suicide prevention. The funding situation might change quickly, the political situation might change quickly. The evidence does change. Even here we see a lot of differences compared to 10 or 20 years ago. And of course also the views, the attitudes of people change. So there are really adaptations necessary, frequent and continuously, and it's so important to make this a sustainable network. And here is, I think, where JASP can come in and Partnership for Life comes in, because this program has been created really to provide a sustainable basis for countries and regions within countries in the European WHO region to collaborate on these kinds of suicide prevention strategies and programs to go forward. And this again includes the networking component, and I would also like to offer here to continue these discussions even after the end date of Implemental. For example, there is the European Symposium on Suicide and Suicidal Behavior next year in 2024 in Rome. In Vienna, we have in 2025 the Global World Congress of ISP. So I really invite you all to make a symposium here and to foster this connection. I think that Implemental can strengthen the Partnerships for Life network considerably, and vice versa. So I think there's a lot we can do together, and that's really the main content of my speech here, that I would like to invite you to take part in ISP's efforts and help this making a sustainable effort that you are doing. So a lot of synergies here. When it comes to the third year, I think it's really also everything that has been said is totally meaningful. It's probably also a bit different depending on the specific country where you are in, because some might have to do a bit more about some evaluation components, other might still be in another phase. But I think it's now really also time to think about the sustainability and the transition, because it only works if there is a good transition to the time after that specific project, and that's pretty soon. So I would really invite you also to get in touch with myself, for example, or with others on the team who are involved in ISB, and help make this a good transition that is sustainable. So that's really my main points. Thank you.
Thank you very much. Stay with us. I hope that we will have some time for discussion at the end. And now, Vasilea. Okay. For now, not. Okay, we will be online again if someone else will join us. And now, please, our representative from World Health Organization, Lady Al-Azheri, what can you tell us? How do you see this project? And please answer to those 4 questions.
Thank you, and a warm good morning to everybody. I am Lady Al-Azheri, the Regional Advisor for Mental Health in WHO Europe, and I'm here together with a team of colleagues from Copenhagen, Anna Tijerino, Kessi Redlich, and Ida Strömgren, that have worked with some of you in various events or various functions. This is to say that I am part of a team that works with both our member states individually, but also at the European level, such as working together with Joint Action and the European Commission. Now, I'd like to start by sharing with you how I would feel if this event happened when I was a resident, a psychiatry resident. I would be joyed. I would be full of anticipation and trepidation for being in a community of like-minded professionals who want to bring change in their countries. Because you can tell my age, of course, when I was a resident in psychiatry, at that time there was not a lot of dynamism in terms of mental health systems and services improvement. There was a lot happening in the area of psychiatry, and I was gratefully, for instance, part of a lot of events that the European and the World Psychiatric Associations were hosting, but not something like that. So, and that brings me to the first question of today. What do you see as key gains of J-Implemental Network? And truly speaking, with both the shoes I feel in today as WHO regional advisor, but also as a former young psychiatry resident, I think one of the key gains is that the project is helping to maintain a critical mass of people around the region for bringing changes into the respective countries and beyond. Because by being here, we not only support developments in one country, but also cross-fertilization. So I think this is one very important gain. And part of that, the other part of this coin is also a gain, because I think we have heard a lot in those last few days about challenges, and this is not easy to take in, because I think when we work in isolation, we tend to believe that the challenges are only ours. So I live in my country is not doing so well, the system is not so well functioning, we don't have so many financial resources, our mental health resources are hemorrhaging, and we believe that this is only a feature of the country we work in. And then we come to these events to see that those are challenges that go beyond borders. It's like mental health without borders. Both the achievements but also challenges are shared. And I believe that this is another gain, because by it's empowering, I think, to realize that the challenges are shared among. And that means that while while trying to find solutions, we also try to address the challenges similarly, or at least with collective knowledge and competence and enthusiasm. So I believe that is another gain by being honest and looking challenges in the eye and trying to address them. Another gain is it's very clear that the countries are at different stages of mental health strategy development. Some countries are now developing a mental health strategy. Some countries are revising or are having a new strategy after a number of those strategies having been developed before. And some countries are in the halfway of implementation of current strategy. So what is very clear is that there is across the participating countries an energy in the policy processes, and I'm sorry, I cannot not mention one country in particular. If I'm going to mention that country, that doesn't mean that the other I don't appreciate the other countries, but I think what I'm going to mention now is very unique, and this is the case of Sweden, because Sweden, Jenny yesterday presented us with this very unique process of 26 government agencies having been mandated by the government, not by one minister, but by the government, and having been given time to work on the development of the mental health strategy. And I think this is the paradigm shift that this brings us to the advice on the third year of the project implementation. What is the paradigm shift that we may wish to suggest and to see in the countries is that rather than reaching out to other sectors on the process of the mental health strategy implementation, we reach out to those sectors before. So they are not afterthoughts. We don't treat them as afterthoughts, or we don't treat them as, oh, by the way, here is my colleague from the Ministry of Education, let's have a meeting. So, and I think if we are able to capitalize on those good practices, that can truly bring a change for a sustainable change. And then the second question regarding what is your advice on the third year of the project implementation is indeed sustainability that has been mentioned. So it's a concern, obviously. And in terms of sustainability, we as WHO try to see it in a very complex way. Sometimes we see sustainability as financial. So do we have sufficient financial means for achieving what we want? But then we see that even in countries where financial means are probably better than they used to be 10 years ago, we still do not have the achievements that we would have liked. Why? Because we do not have a sustainable leadership. And I'm not talking here only about the politicians. I'm talking about those who lead mental health services. Those can be service managers. Those can be leaders of non-governmental organizations. Those can be leaders of a university department that decide on the curriculum of education for the various mental health professionals. So it's also about sustainability of the leadership. How is leadership deciding on what actions take precedence? And then another, of course, financial sustainability there. I don't need to remind everybody that securing financial sustainability is important. And here, what we as WHO are trying to say right now is it's not only important to fund more mental health services and systems, it's important to fund better. Because we know that a lot of our funding in mental health systems in Europe still go to, for instance, institutional care that is amply evidenced to not be therapeutic and not lead towards recovery, let aside at a lot of instances violating human rights. And then capacity sustainability. So we may have leadership, we may have financing, but then do we work to sustain capacities? Do we work to, and that includes both competencies of our mental health professionals, data, for instance, as an auxiliary to the capacities of the systems. So that's why I want to say that sustainability is not only a matter of financing, securing financing means, but also making sure that everything that is available or it can be made available is used well and is used smartly. The third question, what are the synergies between J-Implemental and the WHO activities? It's like the old adage that says, all roads lead you to Rome. In that sense, Rome is the metaphorical mental health apex of good practices in both policies and services. I think we both and in WHO want to achieve this momentum where the treatment gap is narrowed, where people with lived experiences are active part in decision making, in designing of plans, policies and practices, and when human rights of persons with lived experience are fully respected and enhanced. So in that there is a lot of synergy, and we are working together similarly to build capacities, to empower leadership, to maximize or to reduce treatment gap. And the last question on how can WHO support on sustainability and scale up of implemental results is while we will be happy to take in and further forward the achievements, for instance, the dashboard. We discussed yesterday with Antonio Lora and Teresa Di Fiandra about how the dashboard that you are producing can continue to be sustained through this further dissemination, even after the J-Implemental has finished. We would be very happy in WHO to take it forward, but we again would be very happy to empower the stakeholders in this room through our mandate as WHO in convening power, in convening the policymakers, so using our mandate for convening the policymakers and bringing your voice closer to those who make the decisions. And with this, I hope I have answered the questions. Thank you.
Thank you very much. And now...
one moment before we give the floor to John. I would like to ask my colleague Maro if you can see if one of our stakeholders has sent any message and could face any difficulties to link. So to be sure that we have given the floor to everyone that is connected. Thank you.
And now I give a floor to John Sanders Eufami. So how do you see your answers to those questions?
Thank you very much. And first of all, my apologies. I am going to repeat much of what's been said already, but I don't think that's actually a bad thing, and I'll get to that in a moment. But first of all, just to say thank you for allowing me to be here. I was in Croatia last year, and I was hugely impressed with the amount of information and detail and practical activity that was going on the ground in various countries. I'm even more impressed this year to see what the progress has been. And as I was saying to people during the week, in answer to the fourth question, we are certainly going to bring all of the information back and share it with our members who are national organizations across Europe so that they can see a practical example of change happening in their own country or indeed neighbouring countries around them. So to answer number 4, first of all, we are very supportive of dissemination, sharing good practice, promoting it and making sure that people understand that you can actually achieve these ideals despite difficulties and challenges that are obviously present. So EUFAMI, as you know, represents family organizations. And I think one of the things that I always say is that in terms of the new models of community care, that actually means in many cases family care, which was previously provided for by professionals or paid staff in different settings. So we very much support community care models, but we also support making sure that families are supported and provided with the support that they need to play their part in recovery. We firmly believe, as does this project, that recovery is best placed in the community at, you said, localized, timely services, where people are given the type of resources that they need to make themselves better or to be supported in becoming better and leaving the systems. So what I see is the key gains of the joint action, that you're already demonstrating in practice what people have been talking about and reading about in textbooks for many years, the ideal community-based situation where people are encouraged to recover rather than being sustained as mentally ill in the community. I go to question number 2, what's my advice for third year of the project? And of course I will say this, you need to make sure that you formally involve both users of services and family members in all of the projects. I was looking very carefully at the posters Monday and Tuesday and noted that some of them very clearly involve family members, and great. But I think others need to work to create that momentum and interest in the community around them. So it's not just about paid professionals who are obviously very, very important. It's about the user himself or herself being involved in the recovery program. It's about the family member, where appropriate, being involved in that process as well. So I would always say that, but I think it's important that in your third year, maybe you look at more formal objectives around that for the remainder. I think the other thing about the next year, and I was listening very carefully yesterday and the day before, the detail of the projects is very clear in terms of setting out what's required and looking at the outputs that are achieved. And I hear the words outcomes used often in the discussion. Now, as I understand it from listening to people talking about their projects and reading it, they're talking about outcomes as measurable, quantifiable numbers or statistics or statements. So we've managed to get 10 more social workers in a region, or we have opened 2 new clinics where there are individual program plans for people to develop for themselves. Excellent. That's quantitative output, I call it, of a process. Whereas outcomes is slightly different. For me, outcomes is qualitative data or information about something that's happened. So, for example, and don't take this to heart, if we appoint 5 new social workers to a region where there wasn't enough social workers, okay, the output, 5 new social workers, great. The outcome is, what has the benefit of that to the persons who are using the services? So, have they benefited? Have they not? Is there still the same situation? And so on and so forth. So outcomes are qualitative. They're much more difficult to measure. And by definition, you usually have to go and ask people, like the family member or the person who's using the service, how did you benefit from having an extra psychologist in your region, for example? So I would ask you, maybe you look carefully at the project, and I'm saying this as an outsider who's just looked at the information, to focus on outcomes in the meaning of qualitative information, as well as outputs, which is the quantitative information about what's going on. That's just a neurotic issue of mine, so thank you for listening to it. I think the third thing around question number 2 is the obvious issue of change and sustainability that we've heard about so much. I'm not going to repeat all of that. But I've been involved in many situations of change. And the only thing I know about change is that everyone else should change, but not me. And when it comes to it, I think we all have to ask ourselves, would I change in a situation that I'm presented with? Now, that's very, very difficult, but it's essential. I'm involved in various policy implementation processes in my own country. And one of the things I keep saying is, yes, we will all change. But then some action has to happen. I said, oh no, not me. Not me. He'll change, or she'll change, but not me. So it is really important to embrace change and get buy-in from everybody involved. And I'm talking about professionals, I'm talking about service users, family members. I'm also talking about the administrators, the clinical leadership, which is really important. You've pointed out very, very clearly that successful change is often dependent on local good clinical leadership and good willingness to make that shift. Politicians, I don't leave out of it. They claim to control the finances, they control the political activity of a country. They need to understand the importance of what's happening and to understand that mental health service is not a public expenditure issue, it's a public investment. It's an investment in people's lives, in the quality of their lives, and in turn the quality of the society that we live in. So it's the same way a politician would say, yes, we will invest in roads, we will invest in infrastructure to support business, we'll invest in schools to educate our children, we need to invest in mental health to support people who need that type of support. And that's the bottom line with politicians. The ones I've met tell me mental health is a black hole, just loads of money, nothing's happening, and no one cares. Which may be true because stigma is very strong in some countries, and maybe populations don't care. So we need to work on that as well. You know all about that. I'm not going to repeat it. I think the other thing for year 3 is to take the ideal, which is perfectly wonderful and I support fully, but to make it effective, you may have to produce realistic goals which are actually achievable and which people can buy into and sustain over a period of time. So, and I know I accept just changes with economies and just change, all sorts of changes happening around us, and we can't predict what it's going to be like in 3 years' time, or 5 years' time, or 10 years' time. But realistic objectives and realistic projects tend to last longer than the idealistic ones in reality. We know that from history. So in question number 3, what are the synergies? Well, what we're trying to do in our national member organisations is support their active involvement in their own regional services or national services, as the case may be. What's Implemental telling us? That this is possible. As I said at the outset, we will make sure that the country that's represented in the project knows clearly from our perspective what's happening, but also the other ones, because they can share other information from surrounding countries. And finally, how can you support sustainability? Only by continuing to disseminate. Wherever you are next year, I want to be here, because I want to see what the outcome is in terms of the fantastic work that's going on at various levels. I fully appreciate the point you made, a very important point, that different countries are at different stages in terms of the progress along that path, in terms of their economic ability, their political willingness perhaps, and so on and so forth. But they will all get there. Sometime we'll all be in Rome. And I hope that day comes sooner rather than later. So thank you very much, and best of luck to everybody.
Thank you very much. Oh, Maro, have we checked if no one more? So I think we have a few time for questions from the audience that we could answer. Or a feedback from our panelists, to a reflection from our online panelists to what has been said. If anyone wants to add something, any additional questions?
Panelist Lara? Maybe some key points for us from today?
Yes, I think that a lot have been said. It's an amazing work you are doing, and we are of course very happy to be involved in this action, and we hope to continue working with you all and see what the next steps will be for the next year. I just want to say once again that we would be happy to provide input if needed, because we worked with many countries, our experts worked with many countries in the past, and so I'm just here to say that we are very happy to do that again and work with you and collaborate in this very important project. And again, we are happy to share anything that you would like to share with our community, because we think, and it has been mentioned already, that it is important that people know what is happening and they are aware that it is happening. So it's just a call for all of you, and invite to collaborate. Of course, we are available.
Thank you. Lushka, some key messages for this forum?
Yeah, we look forward to receiving more information on the next phase and, maybe provide more detailed input on how we could support the joint action in the next phase. Thank you.
Thank you. René, some key points, key messages for us.
Yes, thank you. Because what I heard really resonated with me, and I want to highlight two things in addition to what I've already said. Good, of course, that to listen to John Sanders. Always good to listen to John Sanders, but expressing the importance of and I would not even use just the word involving, but more a true collaboration with the carers, with the family, with the informal network around the client, that the client can select him or herself, but then it's our task to be open to that. And that in fact brings me to the point, we talk a lot about community-based mental health care. Then we often think it's important to work together with the network in the area where you work. But what sometimes is missing is that the sense of community within mental health care service is not all that strong. So I think you can only become a good partner in your network partners if also internally mental health services are more organized as a community. And so that's also one of the things that we aim for with our EUCOMS approach, is that mental health service becomes a community of clients, of their own informal network, and the professionals. And it also gives then the lived experience of the client and the informal network in place as a third resource. So that resonated. Another thing is what resonated with me is what Lydia mentioned about the sustainability, not just of having more money, fund better. That I really liked. And I think talking about sustainability of leadership, I think it's very important that you emphasize the importance of leadership. And what has been for me really inspiring is leadership as the leadership of the 21st century is about convening. So it's not longer about the pyramid, that you're on the top of the pyramid and tell other people to do. A good leader in these days is a convener, bringing different parties together. I'd like to learn more about the example of Sweden. We saw a similar thing, by the way, in Norway, where different ministries work together on mental health. So the convening different parties at the smallest level in your direct contact and at the level of the government. It's really all about convening, and that's my meaning of leadership. And that's something that I think we have to learn, to find alternatives for a pyramid that's no longer working.
Thank you, René. Thomas?
Yes, a lot of important statements here, and I can only fully agree with them. There's a few things I would like to pick up, specifically working in suicide prevention in such diverse situations as everyone involved here is, and also within our program Partnerships for Life, which is even a bit more diverse because we have countries involved which do not have any program at all, where basically one or two people might run suicide prevention. And it really seems sometimes, as one of the speakers had said, that people don't care about suicide prevention. But we need to keep in mind that even if some, and I say governments might not appear to care, all of us are affected by suicide. And that means that we really have to see what kind of support is needed in that specific setting. And particularly one of the outcomes that I would like to add here from our first work in Partnerships for Life is that particularly in countries and regions, sub-regions where you have no program or no strategy, sometimes a bottom-up approach is really important, and the very first thing to kick off with an initiative, so which means really supporting the one NGO which is responsible for suicide prevention in that setting. And in other settings, obviously in countries with established programs or even strategies, it's both bottom up and top down. And here I would like to get to this other point, which was about continuity in management, not only in finances, but again, I'd also like to come up again with the government continuity, because there are so many shifts here. Some for the better, some for the worse when it comes to suicide prevention. But one problem I see here for continuity is that it's still mainly the responsibility of the healthcare, of the health ministries, health and social affairs. Now, suicide prevention is really a health issue, but it's not only a health issue. As we know, it's many other government sectors which would need to be involved, like interior, like finance, like justice, like transportation. So actually there is a lot of connection here, but it's not often established. And I think that's a main limitation also to sustainability, that it's just not really sufficiently integrated also on the government level for those countries that have it established at all at a government level. And finally, I think moving forward, we really need to do even more for diversity. How are our people with lived experience represented in anything we do? If we look back 20 years, WHO and others have already raised the voice for lived experience. However, it hasn't been at all that strong, and that's again changing. We are seeing differences here. We are seeing rapid changes of which groups need to be included to become more inclusive. There are also changes to what a gatekeeper is. So we have these new definitions of gatekeeper affecting gatekeeper training also. So we have to be very mindful of those changes, and I think that's also will help us to be more sustainable, because it means that we are more included in any form of community, and that should be our goal.
Thank you very much. Thank you for your recommendations. Lydia, some messages for the end.
Yes, indeed, and wonderful reflections. It's really exciting, and I'm very thrilled to be part of those discussions. One thing that I think I forgot to mention in my remarks was also, in terms of sustainability, we also need to be aware that, at least for the last year of J Implemental, that we are doing all this in a very changing world. And the world is changing. The world of today is very different from the world of even 5 years ago. It was just before COVID. And COVID has changed the world in unimaginable ways, including, for instance, the unpredicted and unpredictable penetration of digital tools and digital technologies into the provision of healthcare, including mental health. And in a way, that has not been, I have a feeling that this is not sufficiently being tackled, and probably for ensuring sustainability in the next year, in the next 12 months, this needs to be brought on the table. I don't think 12 months will be sufficient to find solutions, because that is more, it's a longer process, but at least as mental health professionals and mental health policymakers, we all need to factor in the fact that we are living in a changing world, that our, also the communities are changing. What we mean by communities when we talk about community mental health teams, a concept that was designed a few years ago, it's a different concept today with the digital spaces, etc., etc. So probably this needs to be brought on the table for the next 12 months. And the second, when I take very well the concerns about sustainability, and in a way, what is also a very positive aspect of a meeting like this one is that it is a platform where professionals meet with civil servants, and this is not always the case. We usually either have government meetings where you only have civil servants, or then you have professional meetings where you only have professionals. And here we have this opportunity. And if we are able to expand ourselves into a more critical mass of people, then we make sure that when the next government takes over in any country, the minister will have to refer, or the leadership team will have to refer to the same group of people, because that group of people that are reform-minded people are sufficiently large to be able to produce a consistent advice. So, and then I'm saying this because in WHO, because we work with our member states, we know, for instance, we say, okay, we have that number of countries that are going under elections these months. And that means that this is a period of kind of a low level of activities, not only mental health, but in a number of areas. So the bigger this critical mass of people is, the more solid and the more sustainable are the achievements of any project, including the J Implemental. Thank you.
Very much, Lydia. And John?
I'll just make 2 points because we are in danger of repeating ourselves. I fully support Lydia's last comment. When I was working in political advocacy, my first job was to know who the civil servants were and get to know their names, phone numbers, and so on and so forth. And then I'd talk to the minister. And I learned very quickly the minister would leave in 3 years, maybe 5 years, depending on government. The civil servant is usually there for a longer period of time. And they will, of course, advise and influence the minister. So, very important lesson. Second one, just to say, and I've heard it from a number of panelists and from other people, is that mental health and suicide prevention is not just a health issue or even a social issue. It's an issue of all government and all society. And it's amazing what work can be done by other governmental departments in suicide prevention, for example, and indeed in mental health. They may say to you, that's not our business, go to health. But I'd say, yes, it is your business. There's something in your activity that's related to mental health or related to suicide activity or prevention of suicide, obviously. So I think it's important that all of government realise this is an issue, not just 1 or 2 departments. Thank you very much.
Thank you very much, John. And thanks, I want to thanks to all the stakeholders, all the panelists of this forum. And I also asking you to share with us, to send us your input during the whole year and after the implemental also. And please disseminate all our results, everything that we want to be shared. And first of all, those good practices that we want to implement in European countries. And Vasilea?
Yes, I think you have seen that we kept your key messages from the first annual consortium meeting, and we worked on them in a year that was really devoted to developing pilot action plans. Our last year, and be sure that we will take your message and reflections from this meeting for our third year, which is combining a third year of core implementation, supported by all work package leaders and efforts for our 25 pilots, but also in parallel of sustainability activities, and also in parallel of efforts to enhance further through our Member State Policy Committee your reflections to a level that will sustain forward. And with this, I would like to thank you, but I would like to thank our panelists, and we can go down. But I would like to give the floor to Eva, because in the first day we didn't have the opportunity to hear the communication and activities and so far recommendation for future from Work Package 2. So I would like to give the floor to Eva to brief us on this. Eva, the floor is yours. Thank you. Thank you for being here. And all the panelists online. Yes.
So, hello. My name is Eva Karpati-Gray, and I work in the National General Directorate for Hospitals in Hungary. And as you know, we are co-leaders of Work Package 2, which is led by Croatia. And I was honored on behalf of the team, the Work Package, to do this presentation, which will be, don't worry, very brief. because I know that probably you are all eager to have lunch now. Or coffee break, yes. They can't see it. So it's about dissemination and what we have done so far. This is our mandate, what we have to do. Coherent and effective external-internal communication of the GA and ensure that its objectives and activities, results, and deliverables are known to stakeholders and all interested bodies. So I think it's quite precise. And what we had done in the first phase of the project, that was creating the visual identity, the branding of Implemental, and all the communication tools that you have to use when you speak or write or disseminate anything about Implemental. So you see our logo, you see that it's always compulsory to show the funding source. Now, VP2 created the dissemination strategy and identified dissemination channels and networks. The introductory leaflet has been prepared. I was very happy to see that it was used here. It was in Spanish. I don't know if you have noticed that it was probably put there just if anybody comes who hasn't really heard about Implemental main goals and activities, they should know what it is about. And I hope that you have already localized it. By localizing, I mean that you have translated into your national languages. When we provide you material and a template, it's always meant with the intention that you localize it. And it's very important that you should use it in your national language. I hope that you all visited the J Implemental website. It was also an achievement to put up the website that was done by the Croatian colleagues. And it's very important that basic information is there about us, and main activities and events are all disseminated there. And of course, you can feel free to put up a section about J Implemental in your own institution's website. I haven't checked. I hope you all have a section about J Implemental, and you can regularly update that with the news. We also have social media platforms like LinkedIn, Instagram, Facebook, and Twitter. I know that we are not as active on these platforms as we should be. I, again, would like to encourage you to follow these Implemental platforms, because when I see how many of you like, for example, on Instagram, Implemental, or on LinkedIn, it's really very, very few. I would be really happy and appreciate if you would follow us more. You know the tendency of virus marketing. So if you have a Facebook platform that you use on your own, or maybe your institution has a Facebook, then please share our news and spread it, and share it with your friends and stakeholders. That's the main aim. Our name, J Implemental, as a brand, should be more often mentioned everywhere possible. So the midterm report of dissemination has been prepared, so you can see on certain pages what we have done. Another important platform that I would like to emphasize is the EU Health Policy Platform. Again, it's maintained by our affiliated entity, the Semmelweis University, and each month they put up their post. As far as I know, very few of you follow that. So please do that. I mean, we have a minimum input and an ideal input. The minimum input is that you follow what is shared by us, VP2 in the different formats. If you have time, you can translate it. If you don't have time, you can just share it. But the ideal would be that you become content providers. And what do I mean by content providers? I was actually a little bit shocked when I was on the first day in a very nice discussion section, and I learned about some of the activities those countries are doing. And I can highlight Sweden, what they have done with representative of user groups, or Lithuania, what they did regarding the mental health ambassador, and Iceland, the Yellow September, which was really amazing. So I really would like to encourage you that you should inform us when you have such a nice thing in your country related to mental health, and JA Implemental is linked with it, okay? It's very, very important that we should learn about it, and then that way we can also disseminate it on our platform. So please don't hide. You do excellent things. It's very funny. I actually learned during these 3 days that you do a lot more than what you disseminate, which is, I think, a good thing that you are implementing and you are successful. You just don't talk about it, so it's not a secret. Please share, okay? Now, a recent innovation is the JA Implemental newsletter. It was in a way retrospective because it just summarized what we have done so far, and it was published in May. But you should be aware that we are preparing a second one right after this wonderful Murcia event, and it will be all dedicated to Murcia event. So all these beautiful photos, the posters, it will be documented there. And again, when it will be finished, feel free to localize it. You can add a section highlighting your team's achievements so that your country should be aware what you have achieved so far and what is your real role in the implementation within the JA Implemental family, okay? That's really important. The same issue is with the press release. We are going to issue a press release about this event, and I very much would like you to translate it and localize it. And again, what do I mean by localizing? You can add a section that who were here from your organization, what is your role within the project, and what was the real memory or knowledge sharing that you took back with you to your country, and what is that JA Implemental can add to mental health in your country, okay? So that's what I do mean by localizing. And participation at events. I think Vasilia is our ambassador. She is visiting a lot of events, international prestigious conferences and events, where she's talking about JA Implemental, how we implement and what we aim, and how we mean to fulfill all the good intentions that the Commission is planning and decided on mental health. And you can do that in your own country. So if you can identify special conferences where you can speak about JA Implemental, that's very important, because you are the local ambassador in your country regarding JA Implemental. So don't forget that. And if you can identify events, especially where you can reach your stakeholders, which is very important, or user groups, I think it's quite vital to do that. So please keep your eyes open. Well, just highlights. I feel bad because it's very subjective. We heard from the WHO colleague that it's not nice to highlight this and that, and I really don't want anybody to get hurt, but I would like to share with you a few things In Croatia, there were interview series on the Croatian National Radio and Television on mental health, and Daniela was there and talked about Implemental and our goals. In Hungary, I post a lot about Implemental. We are on LinkedIn. We don't have Twitter, and we don't have Instagram in my institution. And Facebook is a bit old-fashioned, and I know that the EU is not in love with it anymore that much. But LinkedIn, I think it's the most professional one among the social media platforms. So if you follow OCFÖ, which is the National Directorate General for Hospitals, I post in both languages, in Hungarian and in English. And if you share the English ones about J-Implemental, I saved you a lot of work. Malta, we all know that that was a very nice webinar to celebrate Mental Health Week. In Cyprus, we all got the press release about their fantastic event on mental health reform in March. Lithuania, they have a mental health reform, and they issued a press release about it. In Slovenia, they had a first mental health festival to the general public. In Norway, they had a suicide prevention video on YouTube. And from Germany, there is the Weser-Kurier newspaper article, a series of healthy children. So you see, there are a lot, and I do apologize if I left out something. We were so busy that not everybody could fulfill the deadline until we wanted to get the actual update on your activities, but never mind. Next time, if you give it in time, then you will be there, okay? That's the deal. Now, I think I have already did this. And again, in red, really, we need to know about your activities to disseminate. I already told this one. Now, I also did this one. And I just showed these links that are very familiar to you. The reason why I show it to you, if you go and visit these links, you have already can see that there were posts about Murcia event. So you can share this, you can use the photos, and you can localize your message on your own media platforms. And in this high-tech world, Stella Kyriakides, the European Commissioner, she was so nice and honored us with her speech at the opening, and already her speech is uploaded. So if you would like to use that also in localization, feel free to do so, but beware that our press release is coming, okay? So thank you very much, and my final message is be a content provider, okay? Thank you.
Thank you very much, Eva, and I also thank all colleagues that have been in conferences just previously to this meeting, to IASP in Pirin, transferring their J-Implemental experience and efforts, and in UFA as well. There will be representatives of J-Implemental Consortium presenting our works and taking our activities further. Thank you very much. And I will give the floor to Eva.
Thank you. I just wanted to say three sentences because I was actually given the floor because I'm also Eva. So I wanted to still ask you, and if you have a little bit of your time during the short break or lunch, if you can check our planned trainings for the VP6 and provide us with some feedback, we will definitely work with that, and we'll be very happy to get some. So thank you very much, and thank you for the space. Thank you.
Sloden.
Thank you. Just for an announcement for the next session, Member State Policy Committee, we will start with presentations, but after that, a debate, a discussion will follow. So I would like to ask all the Member State Policy Committee members present to check in, to know who are here and who are ready to contribute to the discussion with a few thoughts. And I would also like to ask the members who are online to check in at Maro to know whom we can count on. Thank you.
And we start very soon because many of you will leave. So please take your coffees and be back in 10 minutes. Sorry for this tough program. I hope lunch will compensate for that. break. Roldan, can you help? Edita, would like you to sit next to Ivana in front. Inga, that goes for you as well, if you can. Yes, please. Edita, yeah, okay. Andreas from Hungary is here. Yeah, yeah. So you know each other. You are going to work for 7 months for the meeting in June. Persuading bosons line. I don't know, Alex, has Konstantin connected? Sorry? Has Konstantin connected? He's okay? Can you? Okay, if he, so I think. Yes, we will check. We can see the. I don't know if you have received any information that we have any issues. Anders, Bernadette, can you check if Andres is here? Trinu, could you please check in front? Bernadette, Andreas? We have, Sloden will announce which of your member state policy committee members are have already linked. So if we don't have.
Okay, so welcome you at the last session of the Joint Action Implementer meeting. This is the Member State Policy Committee meeting, and we are thankful for those members who accepted our invitations, either on site or online. We have 3 participants online so far: Dunja Skokopolyak from Croatia, Anna Temelkova from Bulgaria, and Frank Belluer from France. Maybe others also will join, but we are starting the session with presentations on behalf of the project, on behalf of the European Commission, WHO, and OECD. So I would like to ask Vasilia Conte first to give her speech.
For those of you who were in the Member State Policy Committee in the audience, excuse me for the repetition. There is a twist, of course, addressing the Member State I give some minutes to the sound to be fixed. Okay. So for those of you who were present in the previous meeting, excuse me for the repetition. There is, of course, a twist for the Member State Policy Committee, but the audience is different online. So for this reason, we needed to have a recap also on the project in a nutshell for this presentation as well. So for the GE Implementer work plan is to implement 2 best practices in the area of mental health, and this is the Belgium best practice that will be implemented in 11 countries, 14 countries all together participate in activities and trainings and sustainability actions or dialogues on Belgium best practice implementation. We will have 17 countries participating and implementing in the suicide prevention best practice from Austria. And from this, we are expecting a lot of new strategies to be developed across Europe. It is important to say that 8 countries are implementing both best practices, showing the great interest, but also the challenge to implement 2 big best practices in one country in 3 years. And 9 countries are implementing one best practice, showing also a great commitment to our project. What are the key objectives of GA Implemental? It is to support member states to improve and promote mental health via innovative and sustainable mental health service change. It is to reinforce the capacity to address a system transformation, to support the transfer and pilot implementation of the 2 best practices, to achieve a strong involvement of national and regional governmental actors to enable such practices not only to be implemented, because we need your assistance also during the implementation. So the 3rd year is crucial for implementation. So it is important for us that you are here and supporting, and of course to embed this in national health systems, to establish a sustained collaboration with member state authorities, but also key stakeholders, both on European and in the national level, to share a common and global vision about mental health. Your work as Member State Policy Committee is to involve the regional government authorities across 20 countries to support this pilot implementation, the embedment in national strategies. And we are lucky that most of the countries, we are also recruiting a new Member State Policy Committee. Some are retiring or changing their positions and moving to even higher governmental positions. But we are all thanking you for your efforts to being here, to sustain, to implement the activities, to support us and think and reflect on how we can move forward after the 3 years of the end of the project. So we have a report of how the countries are working with their Member State Policy Committee members. And we know that you are regularly informed in many cases. You are consulting in 1 or 3rd of the cases. You provide your feedback. And in many cases, you are a part of the team. So it is important to see these great synergies across Europe and across on national level that can help the implementation and the sustainability of the activities. And the key messages, as we had 10 key messages for our other advisory body, we also had 10 key messages from our Member State Policy Committee during the first annual consortium meeting in Zagreb. So the GA Implemental is aligned with the national mental health strategies. This is a strong message from the Member State Policy Committee members. We are given the opportunity to plan and structure new actions to implement new programs and services in the community for citizens citizens strengthening their mental health, and together with all EU member states, we are committed to continue working to provide high-quality services for mental health to all citizens in Europe. GA Implemental supports the new actions on national level. We look forward to support GA Implemental to review our programs through the exchange of experiences, to promote improvement of our services, policies and the health system, adapting best practices which have been applied by other European countries. Knowledge gained within GA Implemental will contribute to the improvement of mental health care both on country and EU level. Member states benefit and require training from GA Implemental, and we have seen how well the training capacities have been taken up by the countries, how much they were involved in trainings both in Work Package 5 and 6. Bring all stakeholders together to one table, creating networks, structures, and encourage cooperation. Engage experts by experience has shown their huge potential toward improving and making services more responsive to users' needs. Active collaboration throughout the process of change. Nothing about us without us. I think we know who told that in the previous meeting. And you see how important are these messages and how some of them, you can see them reflected in our scientific agenda this year, brought up by our scientific committee members on the table of the second annual consortium meeting, giving empowerment to users. We need better data for mental health prevention and promotion. A strong message last year from the Stakeholder Forum, a strong message from the Member State Policy Committee. We must strengthen positive mental health. The GA Implemental best practices are used as justification for our politicians. More generally, international activities are used to justify the importance of international standards to overcome resistances and lead to change. GA Implemental has the power to strengthen advocacy and increase collaboration. Continue strengthening the advocacy for mental health system transformation at European level. Strong messages. Of course, we all know that we have gone through all steps and we have developed our pilots. We have started implementing, and we are, of course, moving to a strong implementation phase across all countries in this period. We are developing pilots for 17 new or updated suicide prevention strategies and 14 community-based mental health programs. Even countries participating are changing activities. They are contributing to learning for now or for the future. We will implement more than 129 activities for the Belgian best practice across all strategic areas, and more than 140 activities for suicide prevention across all strategic areas. We have talked about the main challenges of the best practices, resistance to change, efforts to engage stakeholders, it is a challenge, sustainability of funding and resources, availability of reliable data, shortage of mental health staff, but we have already provided also solutions, and we have exchanged information about possible solutions across Europe during these 2 days. Main positive outcomes: improving collaboration with stakeholders, management tools and methods that can be extended to other regions and sites, community-based services, development and improvement, quick wins, what you can implement quickly and provide results and sustain and justify the activities. Main lessons learned: customization to local needs is crucial for success of implementation. Interprofessional and intersectoral collaboration is key to successful implementation. A realistic action plan must be designed based on activities focused, feasible, and practical. And what are the gains for us, the country teams? And we would like to share with you: sharing of experiences, knowledge increase, strong international network, opportunity for change. what we see as synergies of our Implemental with the new EU communication on comprehensive approach to mental health. Integrate mental health across policies, promoting good mental health, prevention and early intervention for mental health problems, boosting mental health for children and adolescents, helping those most in need, reinforcing mental health systems and improving access to treatment and care, breaking stigma, fostering mental health globally. So we are also moving to monitoring evaluation, an important part, integral part to justify our actions, and we will hear also more about this in the future presentations. Thank you, and I will not go to the questions, which I will lead for the panel discussion later. Thank you.
Thank you very much, Vasilia, for this summary. Our next presentation will be an online presentation, so I would like to ask our colleagues to prepare the online presentation. And the presenter is Stefan Kreinen from DG Sante, Disease Prevention and Health Promotion Unit. Stefan is a policy officer there, and the title is The New EU Communication on a Comprehensive Approach to Mental Health and How It Can be Linked with Joint Action Implemental Activities, together with funding opportunities. So I hope we will have Stefan on the screen and the presentation on the screen.
Hello. Good afternoon. I think my presentation is opening. So just let me use this occasion to thank you for your invitation to be here and to present the new initiative on a comprehensive approach to mental health. I think now you should be able to see my presentation. Is this correct?
No, yeah, because I see the same screen.
Okay.
Yeah. Can you share the presentation, your presentation in the Zoom?
Yeah, I'm trying to do so. Let me try again.
Stefan, I think you have to unshare the screen, then first open your presentation and share again the screen.
Okay. So I'm opening the presentation now, and then I have to share again the screen. Huh? Sorry?
Actually, you share the screen.
Okay. Yeah.
Okay, good.
Yeah, it's working. Good. Perfect. Okay, so I will be fast in my presentation because I believe this is already the end of your 3 days meetings. So again, thank you for being here. Delivering on the commitment by President von der Leyen last year in her State of the Union, the Commission adopted in June the new EU approach to mental health, and this was done after extensive consultation with member states, with stakeholders, and also with citizens, and in close cooperation between the relevant Commission services. Here I put some main mental health figures. I'm sure we all know these. 1 in 6 people suffer from mental health issues, and this is a number from before the COVID-19 pandemic. The costs of not doing anything are up to 600 billion euros a year, representing 4% of the GDP. And then also 1 in 4 workers experience work-related stress. And then last year in the Health at a Glance report, it was shown that 1 in 2 young people report that they have unmet needs, and that that depression in that age group has doubled, more than doubled even. The new communication draws on 3 guiding principles that should apply to every EU citizen. So there's access to adequate and effective prevention, access to high quality and affordable mental health care and treatment, and to be able to reintegrate into society after recovery. And these are the guiding principles that are at the basis for achieving the objectives of this new approach. So our new comprehensive approach, it was developed in close cooperation with all the relevant Commission services, and it strongly includes other areas than public health. It will help to make mental health a priority that is equal to physical health, and with 20 flagships initiatives and 1.23 billion euro in funding opportunities, we will help to bring down the numbers which were shown in the previous slide. So this is a slide with the first 20 flagships. And these are the remaining 20 flagships, and I will present these a bit more in detail now. In the chapter on integrating mental health across policies, we have 1 big action, which is the European Mental Health Capacity Building Initiative. So this year, the Commission will allocate 11 million euros under the EU for Health program to support member states in building capacity for an approach that promotes mental health across all policies. And we do this together with the WHO. A survey has already been carried out this summer to identify the needs and the situation in each member state. And the WHO is currently preparing the report on the basis of this analysis. And maybe Lydia, who speaks later on, can say a bit more about this in her presentation. Then also next year, we will launch a blueprint, a toolkit for a multidisciplinary approach to mental health capacity building. I believe that this is exactly an area where the results that come out of the joint action implemental can be very helpful. There are 5 main actions on promoting good mental health, prevention, and early intervention. We have 6 million euros to support the development and implementation of depression and suicide prevention policies in member states. And this will be based on the exchange of best practices, and a call for best practices will close Friday next week. But also here, again, the results of JA Implemental will be very helpful. Another action is to strengthen the mental health strand in the Healthier Together initiative. And we will do this with 8.3 million euros, creating new policies, for example, on breaking stigma and discrimination. Another action is to set up an EU repository under the EU best practice portal. So the idea is that we have a dedicated place where we can store and access best practices on mental health. Then, in line with the European Code Against Cancer, we will also develop a European Code for Mental Health. So we have 2 million euros for that to develop a set of recommendations which are evidence-based, which will help people or citizens to better take care of their own mental health. And then there is also a joint ecosystem for brain research action, So this will help to better address mental health issues related to brain health by working in partnership with member states, researchers, stakeholders, so we can better coordinate activities, avoid duplication, and establish more synergies between ongoing and new research activities. Boosting the mental health of children and young people is a key part of the mental health communication, and we have 4 main actions here. Next year, we will support the creation of a child and youth mental health network. And the idea is that in this network, children and young people can exchange information, can find mutual support, and outreach will be done by youth ambassadors. Then we will also create a prevention toolkit, action number 8, which will focus, of course, on prevention, but also on early intervention of children at risk and addressing links between mental and physical health and determinants. Concerning the setup of a Youth First flagship, we will develop tools to address healthy lifestyles and the prevention of mental health problems in close cooperation with children and young people themselves. And then a last and quite important action is the Healthy Screens, Healthy Youth initiative, under which we will develop several activities to protect children in the digital world. As with all EU health policy making, the focus of the communication on mental health is to reach and involve vulnerable groups and socio-economically disadvantaged groups. And in cooperation with other Commission services, we have developed 2 specific actions. One is on protecting victims of crime and improve their access to psychological and mental health support. And the other one is to set up a platform for young cancer survivors, so their mental health can be, let's say, supported through this platform. Another important topic is tackling psychosocial risks at work. The first action here is an EU-level initiative on psychosocial risks. What this means is that the Commission will conduct a peer review on legislative and enforcement approaches to address psychosocial risks at work in the member states. And another action is the development of 2 EU-wide workplace campaigns. One will focus on safe and healthy work in the digital age, and the other one will address psychosocial risks and mental health at work with a focus on new groups and overlooked occupational sectors, let's say agriculture or the construction sector. With the new mental health communication, we also aim to reinforce mental health systems and improve access to treatment and care. A first action here is the initiative for training and exchange of health professionals, but also other professionals, such as teachers and social workers. A call was launched right after a call for tenders was launched right after the adoption of the communication, and the tender is now closed, and we're now evaluating the results that we got in. And if all gets well, I think around let's say spring next year, this initiative can start. Then there is the technical support for mental health reforms action. Now the TSI, the Technical Support Instrument, is an EU program that provides tailor-made technical support and expertise to member states to design and implement reform. And under this specific action, member states, we may provide technical support to member states to design and implement mental health reforms to improve the availability of an integrated cross-sectoral mental health service. And again, here the results of joint action implemental will be very useful and very helpful. And the last action under this chapter is to gather additional data on mental health. An important topic is to break through stigma and to address discrimination. And under this action, we will specifically look at actions such as the identification and implementation of best practices, to support stakeholders on awareness-raising activities, to introduce communication activities, but also in cooperation with the mental health subgroup of the experts, of the public expert group on public health, we will develop EU guidance on breaking through stigma and discrimination. And here the last two actions relate to fostering mental health globally. Under the first action, we will support the provision of psychological first aid to people affected by the Russian war of aggression against Ukraine. And we do this in close cooperation with the Red Cross, and almost 30 million euros is available for this action. And then in the context of the minimum service package on mental health and psychosocial support, we will support humanitarian actors to deliver quality care in humanitarian emergencies. And here's some words on how we plan to implement these actions and the communication. And we will do this in close cooperation with the member states and with stakeholders. And for the member states, we have set up a subgroup on mental health under the public health expert group. And with the stakeholders, we will do this via a new online network, which will soon be set up under the EU health policy platform. And we are now coming to the end of my presentation. Just very briefly, some next steps. So work on implementation continues with stakeholders whom we met last week in a webinar, and with member states for which a webinar is planned tomorrow. Then our contribution to World Mental Health Day is a high-level conference on mental health, which is hosted by Commissioner Kyriakides on the 10th of October, and you're invited to join. Then the Sun Committee of the European Parliament is preparing for the first time a mental health report. And if I remember well, the amendments to the report were discussed last week in Parliament. And then important is also that there's strong support from the Council. This year, the Spanish presidency has announced that they will be preparing conclusions on a general approach to mental health, but also more dedicated conclusions on precarious work, on youth, and on drugs. And here my presentation finishes. Thank you very much.
Thank you very much, Stefan. So we could see that coordinated efforts take place at European level, and these are resources, for creating resources, and I hope that we can utilize the most at European level and national level, and at the users level as well. So I would like to ask Lady Al-Azhari for the next presentation, which is a very exciting topic, especially for me. That's leadership, a reflection from WHO in leadership for implementation. Lydia, the floor is yours.
Thank you. Thank you. It is a pleasure to be here again, and especially talking after Stefan, with whom we have been engaging in at least the last year on preparing for this collaboration agreement that Stefan mentioned in support to the flagship one of the EU initiative on the new comprehensive approach to mental health. I don't have slides, and Stefan mentioned also that I might be presenting the results of the survey, which actually I'm going to do tomorrow in the, what was referred to as the Public Health Expert Group in Mental Health. So this has been a survey on mental health capacities, mental health systems capacities of the EU member states plus Iceland and Norway. And we were very impressed to have a very 100% response rate by all the 29 member states, which is to us, both to us as WHO, but also the Commission, I suppose, a sign of the great interest and need for undertaking actions to improve mental health systems and capacities. The survey focused on 3 blocks that considered policy processes, policy content, but also areas such as mental health workforce and a little mental health legislation and a little bit on mental health financing. So it was more about the governance of the systems. And it has been very interesting to find. Of course, you can imagine that the survey did not discover things that we did not know, rather than legitimize, like the findings of the survey, give us all a legitimacy to advise on tailored made and informed actions that are aligned to each country priorities and situations. We also examined in this survey barriers for policy implementations as well as empowering factors. And it is very clear, for instance, that one barrier in the implementation of policies is the buy-in. So how much buy-in we have from the public of mental health policies and frameworks in general. So wherever this buy-in is low, the countries recognize that this is a major barrier for implementation. And therefore, how can we make sure that the policy frameworks that we are making in place, and when I say we, I don't refer to myself as WHO, rather than as a member of the European mental health community, workers. So how can we make sure that the buy-in is increased? There are a number of ways, and as I mentioned in the previous session, we need to both empower the community level, and this is done through, for instance, John Saunders told us about the importance of involving families and carers, and of course mental health service users as the primary beneficiaries of the services, but also by empowering leadership. And this is what I'm here to talk about. Now, let me do a little bit of a deviation and inform you, for some of you who might not be aware, of the flagship initiative, this time of WHO. We have a lot of flagships, and it is nice that mental health is a flagship now in many, more than one organization. So WHO has mental health for the first time in Europe, a flagship initiative. That means that WHO is not only investing more to mental health, but it also politically supporting mental health more. And I'm always very impressed when our regional director, Dr. Hans Kluge, goes to meet with ministers in all our 53 member states. In most countries than not, there is a concrete demand about embarking upon mental health actions. And this is both for EU member states and non-EU member states. So just to tell you that probably because of COVID, there is a higher awareness and demand for mental health actions. And part of that flagship, the way how WHO Europe is addressing this increased demand was through the establishment of what we call the Pan-European Mental Health Coalition. We call it Pan-European because it has to be, you have to remember that WHO Europe has 53 member states, so it's all the EU member states and Western Balkans, Central Asia. But it's not only pan-European geographically speaking, but also pan-European in terms of all the important stakeholders in WHO, where the word stakeholder is probably slightly different from the way it's used here. Stakeholders, be those academics, be those government representatives, be those persons with lived experience, NGOs, professional associations, etc. We have nearly 300 members, and many of you here in this room, I recognize we have also met in in the Mental Health Coalition meetings. So we have nearly 300 members, individuals and organizations, and with them we did a prioritization exercise about what do they want WHO to prioritize. And guess what? The first priority that the WHO European region put on the table was mental health leadership. Then there are 5 other priorities, such as mental health of children, adolescents, older people, mental health in emergencies, mental health at the workplace, and mental health service transformation. But number 1 is mental health leadership. So if we are talking here about mental health leadership today, is not a coincidence. It is, as obviously coming from all of you in the room and those online, it's a shared concern, and this is then how we are hopefully coming to propose something that you will hopefully take in. And this is with a number of partners, such as, for instance, the International Initiative on Mental Health Leadership, and more, not only. We have developed we have drafted a leadership course, a mental health leadership course that, as I mentioned before, is not necessarily addressed to only high-level people in respective ministries of health, but is addressed to all those who, through their work or through their volunteerism or through their engagement in the non-governmental sector, have a role to play in shaping mental health frameworks, mental health services, and so on. So that is a summary of the wisdom that has come through implementing projects here and there in Europe, and we would like to propose it within the frame of joint action, but also within the larger frame of WHO supporting Flagship 1 of the EU initiative as a tool for improving the buy-in of mental health policies in the respective countries. I propose this here with a lot of humility. And the humility is on the fact that all of you here are not only very good mental health experts, but you are also very good mental health governance experts from your own countries. So you, better than anyone in WHO or in the Commission or in the Joint Action Coordination Team, you know how your country is organized, you know what are the barriers. So if we are proposing this tool, this opportunity, it's indeed as a capacity building for each and every one participant on that capacity building exercise to take it forward in their countries. So we are not wanting to push one size fits all, rather than to systematize the collective wisdom gathered by probably failures, lessons learned, but also successes and achievements, make it systematic, and then enable you and empower you in your countries to identify allies, to identify champions that can bring forward the mental health reforming actions in a sustainable way. So we will continue to talk with Vasilia, but we'll continue to talk with Stefan in Brussels and at the Commission and other colleagues from the Santé team, and to see how we can operationalize this proposal, of course, in the hope that there will be a buy-in and consensus from all the concerned into this initiative. And with this, I'm happy to take any action, but I'm also asking for your permission to leave a bit earlier because we have a flight to catch in Alicante. Thank you so much.
Thank you very much, Lydia, for this leadership speech, not only in content, but also in style. So I think we were energized, and I wish you that you could absorb this energy and transfer it to the other colleagues. Thank you, Lydia. And now we are moving forward to OECD. Our next presenter is Marion Devaux from OECD. OECD project on economic assessment of candidate best practices in mental health prevention and promotion. So we were talking about leadership. Now the economic aspects, finance is on the floor. Maria, the floor is yours.
Thank you very much for the introduction. Thank you for the invitation to present the OECD work at this conference. And can you see? No, I wait my slide to be uploaded on the screen. Yeah. So I will focus my presentation. Are you going to apply? Okay. Please. My presentation will focus on the OECD project co-funded by the European Commission on assessing best practice in public health and more specifically on best practice in mental health. And I will present you how we can collaborate with the Joint Action Implemental. So as most of you know, mental health disorders are widespread. There is a significant share of the population across EU countries that suffer from mental health disorders. So according to the latest data from the Health at a Glance Europe publication in 2022, 17% of adults have depression or symptoms of depression in the 10 countries for which have data available. But this average hides some disparities across population group. In particular, young people are more affected by symptoms of depression and depression. So in the countries for which we get data, 20 to 43% of young people reporting having depression or symptoms of depression in 2020, 2021. There are also some population group more affected, as we discussed during the last 2 days. People with vulnerability to mental health include population with low socioeconomic status, migrant or displaced population. So the cost associated to mental health condition is huge, and I will repeat the figures presented by Stefan Kranen just before. Overall, it costs 4% of GDP, but let me go into the details of the different items of this cost. So across 27 European countries, nearly 200 billion euros are spent on treating mental health condition. In addition to this healthcare cost, there are costs on social services and labor market costs. The data, the evidence shows that people with mental health disorder are 20% less likely to be employed than people without mental health disorders, and they are 60% more likely to be absent from work than people without mental health disorder. So overall, it costs 600 billion euros for European countries, representing 4% of GDP. So action is needed, and this was clearly presented in the presentation made by Stefan before me. The European Commission and the Member States' focus is on identifying and transferring best practices. So over the last few years, the European Commission and its expert group on public health have placed a high priority on identifying what works best across member states and supporting mutual learning. So for instance, there is this best practice portal. So you can see on the slide here an image of this portal where you can, which is a portal to highlight best practice in different countries, so selected by the Public Health Expert Group. As mentioned by Stefan, there was a recent call for best practice in mental health that is going to close by the end of this week. And the European Commission has also guided joint action to test and scale up new policy on the ground, and this is what Joint Action Implemental is doing with the implementation of 2 best practices the Belgian reform and the suicide prevention in Austria. So how does the OECD contribute to this picture? So let me give you an overview of the OECD Best Practice Project. So I remind you, it's a project co-funded by the European Commission. It started 4 years ago. We published a guidebook to help countries select, implement, and evaluate best practice in public health. You can see the cover of this book here on the slide. We produced in-depth analysis of candidate best practices in public health from both EU member states and OECD countries. And we provide advice to the European Commission, to its expert group on public health, and joint actions, testing new candidate best practices for future assessment. So we are now working specifically on best practice in mental health prevention and promotion. So we identified so far 10 candidate best practices. These interventions are aligned with the OECD framework of mental health performance. This framework recognizes the importance of actions to reduce suicide, to improve mental health literacy, any actions based in schools or based at the workplace, interventions that focus on frontline workers, such as school teachers, nurses, midwives, and paramedical professionals, and actions that aim to make an easy access to mental health services. So we start with a preliminary set of 10 candidate best practices that we identified using the best practice portal of the European Commission. We use as well the best practice portal of the EMCDDA, the European Monitoring Center for Drug and Drug Addiction, and it's also from our research. So you can see on the slide these 10 interventions, so the Belgian reform and the supra intervention, part of this joint action. We also selected I Fight Depression, which is an online web-based tool for people with mild and moderate depression, and it's led by the European Alliance Against Depression. There is a prompt mental health care reform in Norway that we studied as well. Next Stop Mum, that focus on women in the postpartum period. Then we have 4 interventions that focus on children and youth. Planet Youth from Next Stop Mum from Poland is, So the 4th on youth are Planet Youth in Iceland, HiCert from Finland, Trampoline from Germany, and The Peace Friend, which is implemented in several European countries. And the last one is ABC of mental health, which is a mass campaign to inform about mental health in Denmark. So we evaluate each of these interventions using a standard framework that was co-developed by country. I'm not going into the detail of this framework, but just for you to know it exists. 2 important points. So we aim to carry economic evaluation of these interventions using the OECD micro-simulation for strategic public health planning. So the idea of this model is to carry out economic analysis, cost-effectiveness analysis of intervention, taking into account the long-term effects of interventions. And we will carry out transferability analysis. Here it's indicator-based high-level assessment of the potential of transfer of an intervention from the owner country to receiving countries. So on the transferability, I wanted to present you the 4 contextual factors that we use and that can affect a successful transfer. So these 4 contextual factors are first the population context, which relate to the population characteristics, cultural factor, socioeconomic factor in a country. The second is a sector-specific context. So here it relates to mental health professional capacity and training, access to psychological consultation. The economic context, it's about the affordability of the intervention and the investment in prevention, in particular in mental health prevention. And the last is the political context, about the priorities on the political agenda, the national programs and plan undertaken in the country. And for that, actually, we use the data from the WHO EC questionnaire on mental health policy capacity that was mentioned by Lydia and Stefan before me. Just to give you a concrete example of the outputs we are able to produce with our microsimulation model. So I take here an example from the publication on preventing harmful alcohol use. So we evaluated brief intervention in a primary care to detect harmful alcohol use disorder and heavy drinking. In particular, so this intervention is shown to be effective to reduce alcohol-related diseases. It reduces costs associated to treatment of alcohol-related diseases, and it has also an impact on labor market costs. And we evaluated that the savings related to this labor market cost can be as high as 5 euros per capita per year, in some EU countries, mainly driven by gains in employment, gains in reduced absenteeism and reduced presenteeism at work, and reduced early retirement as well. So let me go back to the joint action implemental. Over the last 2 days, as I was present and I listened to all this presentation, and there is a great effort and great progress in all the information you collected. The joint action has shown to collect and to build data and indicators that make a transfer doable and successful. We heard about the assessment need, data collection, the dashboard for the mental health services provision and quality of mental health care, and the outputs and outcomes for the monitoring and evaluation of the pilots. The joint action is also gathering the lessons learned, and we heard a lot about the lessons learned as well, the do's and the don'ts for a successful transfer of mental health policies. And the outputs from the joint action will be useful to help other countries implement and transfer the best practice, the 2 best practices. And the EUCD is happy to collaborate with you, with a joint action, in order to provide the economic assessment and the rationale for future scale-up and transferring of the interventions. So that's it for me. Thank you very much.
Thank you very much, Marion. We are all looking forward to working with you, and we will expand this knowledge in the future months. With this, I would like to ask those Member State Policy Committee here present on site to step in and have, along with those online, a reflection on what we have heard. And first answer to 2 crucial questions that will guide our work during the next month in preparation for a policy level, member state policy level committee to take place in June in Athens. So we have a lot of work in front of us, but I hope what you have heard today will assist you in its further. Zlodon will guide this conversation. I will be here to listen to you.
Okay, thank you very much. So altogether, if I know correctly, we have 5 participants here, and we have an additional 5 members online. So I would be happy if we could see the people in the Zoom who are online here and there. And before introducing the member state committee members who can contribute to us, I would like to mix the two questions circulated earlier because we have a limited time, but we would like to receive your valuable input. So the first aspect is how do you see the progress in your country and how can you assist the progress in the next year? And the second question is that, as you may know, that the Member State Policy Committee is one of the advisory bodies of the joint action. What advice can you give for the joint action for the last year, which is focusing on the implementation and on the sustainability? So here next to me, I can introduce Ingibjörg Sveinsdottir from Iceland, Ivana Svobodova from the Czech Republic, Trinu Talt from Estonia, and Edita Bishop from Lithuania, and András Sümegi from Hungary. And in the online space, we have Dunja Skoko-Poljak from Croatia, Anna Temelkova from Bulgaria, Frank Belliver from France, Kristina Diether from Austria, and Stephanie Xiereb from Malta. And it would be nice if we could start the discussion with the online members and then arrive back to the room. So I don't know who is ready to start from the...
I can start if it's okay. Greetings from Croatia, from Zagreb to everybody. I would like to share with you some of the most basic information about the activities that we are undertaking in the field of improving mental health protection in Croatia, which are related to the objectives of this project. First of all, within the strategic framework for the development of mental health until 2030, which was adopted by the government of the Republic of Croatia at the end of the last year, the direction and goals that we want to achieve in this area by 2023 have been 2030 have been determined. A part of our goals has already been built into the amendments of the law of the healthcare that was adopted this year. According to this amendment, which states that within the framework of physiatric activities at the primary, secondary, and tertiary level of healthcare, mobile teams can be established, and that at the primary level, dispensers for the mental health care can be established within the health centers in order to make care as accessible as possible. In order to complete the implementation process, a procedure is underway to adopt a public health network that will include these mobile teams for mental health and dispensers for mental health as part of it. At the same time, a special rule book will determine the standard composition of workers in mobile team and dispensers. In order to start activities for the work of mobile teams already this year, the Ministry of Health signed a contract with the University of Physiatric Hospital Vrapče for a project in which all these necessary elements for the work of the mobile physiatric teams in the community are in place for education, protocol, etc. And they will be further elaborated during this year. At the end of this project, we expect an example for good practice that will serve us as a landmark for the future continuation of the work of these mobile physiatric teams. It is also planned to open 4 dispensers for mental health as a pilot project by the end of this year, and discussion with University Hospital Zagreb on the topic of improving the operation of hot telephone line for emergency situation are also ongoing. At the end, in this last year, I think that it is important to invest additional efforts aimed at the realization of all planned activities, both at the national and European level, with the aim of achieving all these foreseen goals of this project. Wouldn't be easy, but I think that together we can make a big step forward through small steps. Thank you very much.
Thank you. Thank you very much, Dunja. So, whom can I hand it over? And we are happy if you can summarize the achievement quickly and if you can give us some advice, some pieces of advice.
If I may, I take the floor. Christina from Austria. Hello to everybody. I would like to thank the previous speakers and for all the important points that they raised, because I think one of the real benefits of a joint action like this one is the support to member states concerning the political visibility of the topic, which is so crucial for the sustainability of our interventions. For Austria, I would like to say we are honored that our suicide prevention approach, SUPRA, was chosen as one of the models of good practice in this joint action. But even so, this does not mean that everything is already done and that we can lean back and observe the situation. We all know that mental health load has increased through the COVID pandemic and the subsequent crisis. So we still have to work on improving our activities, and the joint action is one of the one valuable input to help us do so, to reflect and the topics that you bring up here with our expert bodies, like, for example, the SUPRA expert group that we have to advise the suicide prevention strategy in Austria, but also the Mental Health Advisory Board of the Austrian Ministry of Health. And I would like to also announce or inform you about another initiative that we are chairing here in Austria, which is a European initiative under the auspices of WHO, which is about health literacy, measuring health literacy. It's the so-called MPOL network, Measuring Population and Organizational Health Literacy. And what we observed from previous survey is that mental health literacy is one of the topics that is harder for people than physical health literacy or somatic health literacy. So in the future, we will have a module on measuring mental health literacy in this network to support our activities also from this end. And especially in a situation where we observe staff shortages across the healthcare spectrum, including mental health care, we think it's really important to focus on mental health in all policies and to do preventive work in different settings, like school settings, for example, or at the workplace, etc. And mental health literacy will be one pillar of our activities in this respect. What advice would we give to the joint action for its third year? We think it's really important to keep this momentum of political visibility of the topic and of commitment upright. And probably it would be worthwhile to think about tools like policy dialogues across the countries that participated to bring some of the results more to the attention of decision makers and to ensure sustainability of the outcomes of this important joint action. Thank you very much.
Thank you very much, Christina. So I think we have lost Anna for time. Stephanie
Maybe
or Frank?
I can take the floor. Can you hear me?
Yes.
Okay. Well, I would like also to thank the previous speakers, and the presentation today's were really inspiring and important. With regard to the two questions, just to remind you that France is not implementing, and our tasks in the joint action implemental was to conduct a comparison between France and Belgium of the ongoing reforms, And so in close collaboration between my team at the Ministerial Delegation for Mental Health and Psychiatry in France and the similar group in charge of the Belgium reform, we conducted, in close collaboration with them, we conduct this comparison of public policies and reforms, and important lessons were learned during this work, and I propose to summarize these lessons for you today. So first, one important issue with regard to the progresses in terms of mental health and psychiatric policies is to conceive mental health policies as interministerial approaches, and this is completely in line with international and standard guidelines. Another important when implementing and when creating reforms in mental health is to target specific mental health needs in specific population, and probably in the implementation we have to adapt the mental health policies to these specific population with the specific strategies. That's another important lessons learned from the comparison of our two reforms. Another important common concern between Belgium and France was the importance of local groups of governance to ensure bottom-up and top-down dialogues, and of course also to include persons with lived experience and families at a local level to implement national policies. It is one important specificity in Belgium and in France to have a dedicated team in charge of monitoring the implementation of mental health reforms. And some countries have made the same decisions, and it's very important for the implementation of this reform to have at the central administration a dedicated team to facilitate multi-sectorial approaches and to coordinate all the actors, all the important actors for the implementation of mental health policies. Another important lesson is the importance of training, pre-service and in-service training of professionals is a key issue for the implementation of mental health policies. Another important lesson is to monitor and to create indicators to work with predefined indicators to measure the impact and to follow the implementation. That's the general idea of measuring and monitoring the development of these reforms. And last but not least, the monitoring, the importation of international standards to national policies is also both a source of inspiration, but also something that help the implementation of national mental health policies. All these lessons are very important, at least in France. Recently, President Macron has called a new national conference on mental health. And of course, these conclusions of the work we conducted with Belgium, who started his reform 10 years ahead of us, is very important to feed the objectives of this future national conference. So just an illustration on how this the work that has been conducted during in the joint action is important to feed the national initiative, such as the next national conference called by our president. Thank you for your attention. I should add, sorry, that I will leave you at 2 o'clock because I have to join my consultation, and I'm really sorry for that.
Thank you very much, Frank. And now we could see an example on the inter-country collaboration. Stephanie, how do you...
Hi. First of all, good afternoon, and I'd really like to thank all the organizers of this for this opportunity, because Malta, and I know there are a number of our team there, has benefited enormously from all the expert advice and training which has been provided at, may I say, a very timely moment for Malta, because we are in the process of reforming our mental health system, following the mental health strategy, which had been set up a couple of years ago. So increasingly, we are, whilst maintaining the inpatient services, we are expanding our community services. And the focus is on improved collaboration with various stakeholders, so that we can adapt our community services and other additional services according to mental service user needs. Malta is participating in both projects, and to that effect, I would like to thank all the experts who have provided the training. We have primarily over the last year focused on the prevention and a preventive strategy. In fact, one of the services that we have set up is our mental health services helpline, which has been increasingly resorted to both by patients themselves as well as carers. And the whole country now is doing a mental health campaign, whereby we started by focusing on the general population and then addressed particular groups. So there was targeted groups for elderly and loneliness, and are moving on to children and young adults, and also tackling mental health in the workplace. So we have the perhaps lessons learned is the importance of collaboration. We have, thanks to the projects, intensified our collaboration, working closely with our primary care counterparts. And we have also focused on training of many of our staff. What has been quite a first for Malta is patient empowerment and the peer support and peer involvement in part of the team. This has become possible through close collaboration with yourselves and experts, and this is something which we are launching over the coming months, with identifying peer experts to be able to be part of our team. We did also introduce another very interesting service, which is intended to be a kind of crisis service, which is preventing some of the hospital admissions and following up patients on an outreach basis for a short period of time, transit period of time, for about 3 weeks. So this is perhaps, these are a few perhaps previews of the latest services that we have introduced. So I'd like to thank all of you for this opportunity for us to understand and collaborate to improve on evidence-based, following evidence-based practice, and improve our mental health services delivery. So thank you.
Thank you very much, Stephanie. So now we could see the clear links between the national initiatives and the project. And now I'm turning to the fellow members here in this room. Inga, can I start with you? How do you see the progress, and what do you advise for the whole consortium?
These days have really made me think. And there is this one Old Norse poem that keeps coming to my mind every day. And I think that is probably the heart of the key message that Iceland wants to give to you today. It comes from the Hávamál poems, which are the wise words of the Viking god Odin. Bear with me. Lítilla sanda, lítilla sæfa, lítil eru geð guma. Því að allir menn urðu jafn spakir, hálfveröld hvar. Of small sands and small seas, the minds of men become small. If they don't travel and just stay put, they are only really half wise. This network is precious. We learn so much from sharing our successes, sharing our mistakes, where we could have done better. Our minds will become small if we don't travel and don't share. So we need, even though we're coming into the last year of JA Implemental, if we lose this connection, we are losing so much. So this is our key, the heart of our message that comes from over 1,000 years ago. It still applies today. In Iceland, we are doing okay. We could be doing better. But for the future, this is the heart of our message to you. Thank you.
Thank you very much. Ivana.
Okay. I try just brief some information about what we did in our country, thanks to JA Implemental. Really, some changes can be prepared or are done thanks to team what we has, and also thanks to team what is in JA Implemental, because they are really experts who can help, not just that Supra can help all other states, but also all other states involved in the project can help, for example, Austria or Czech Republic to be better in suicide prevention. But to be concrete, for example, now we are in preparation of some training of staff, rail staff, on communication with people who could be at risk of suicide. Or we are preparing some methodics for school workers, for teachers and others, how to communicate with children, how to find out some signals what can be significant, and then important to find any problem in the behavior or any problem in the family. So these are some concrete things. Also, we prepared a website, sebevraždy, it's like suicide.cz. And there are many informations about suicides. This information are also for people who are thinking about suicide, but also for their relatives, or for experts, for teachers, for anyone else who don't know what to do. They meet someone. And there are also online support for the people, all of them. So I think it's really, really good. And I can say that without JA Implemental, maybe we find a way also, but it will take a longer time. And I would like to mention that we are still finding the way how to involve more people for whom these activities are. We are in touch with some organizations, for example, organizations for people or of people with mental health disorders or mental health conditions, any conditions, and also for carers of these people. But it's more difficult to find the target group of people who are thinking or how is the correct word? I don't know. I don't want to say commit, but who tries. Yeah, thank you very much. Suicide. So it's not so easy, and I think we will we were more have to more work on it. And my advice to J Implemental, it's not easy. I'm not expert, but I think they are experts. So my advice is use this expert. We got just 1 year, and I don't want to be in delay as now the screen is. We are talking about something, and screen is I think 10 seconds after it. So don't be in delay. Use the expert. Don't think too much about some things what are not such necessary, and just keep in mind that it doesn't stop with the end of J Implemental, that the collaboration can be further.
Thank you so much. So let's continue the collaboration. Continue with Trinu.
Okay, thank you for uniting the two questions, because my advice will be derived from our own experience. In Estonia, we're doing fine. I mean, just that you know, for an Estonian, if I say they're doing fine, actually they couldn't be doing any better. But to talk about suicide prevention, to my surprise, our first win was to get all these people together in a steering committee. I didn't expect it. I mean, Estonia is small, everyone knows everyone. These people know each other, they talk about things. But once they were in this room, in this very specific constellation, from psychiatrists, the people who pick up the phone when the person rings to the helpline, they were together with a very specific task to discuss suicide prevention and none other, and with the knowledge that this will be formalized into an action plan with a very high probability to be implemented. So, I mean, so many ideas were born were sprouted out from this very fertile soil, which will all be in our action plan, obviously. But some of them are already a work in progress. For instance, totally revamping the training of helpline workers, because we discovered that it's kind of a meh. But we are revamping protocols and outreach teams. The very same things. I mean, the teachers want to help, but they don't know what to do. But we now have an outreach team which goes on site, where after the event, and help the family, help people around or linked to this event, but they also help the professionals local professionals who have to help the family anyway, but they are not aware of the specifics of a suicide prevention, so they may do harm if not properly advised, but they may do a lot of good if they get the advice they need. And we have a quick win. 3 weeks ago on the World Suicide Prevention Day, we launched our first Papageno Award to the journalist who made a most responsible article on the topic of suicide. And that is very well received amongst journalists, because this kind of click and attention economy waters the weed in the media, and someone has to water the flowers. So we do it now. So one of my advices is that bringing people together is already has a value in itself. And the other one comes from Work Package 5, the Belgian reform. I mean, with all my admiration towards Belgian reform, no offense, that wasn't the first time we thought about mobile teams when we were inspired by Belgian reform. We thought about it a long time ago. And since that, we've been searching for resources, information, the experience of others, and money from every kind of possibility, from state budget, from European projects, joint actions, and that was also one small piece of a bigger plan. So every small project in itself would not have been sustainable, but as a part of a longer strategy, it is sustainable. So Alexander brought up the deep state. I mean, I'm a very big fan of a deep state. I even have a jersey written where deep state and proud has been written on. And that's what we do. We keep things going. We keep the contingency. So my advice would be, for the third time, let's think of a follow-up. There must be some follow-up to make this sustainable.
Edita, please.
Hello. First of all, I would like to thank to everybody for the great effort you all made. So what we heard in the last 2 days is really great effort. We all achieved, and we can applaud to ourselves. Yeah. And for Lithuania, we also made big changes, and we prepared a mental health reform strategy, which we're moving forward with. And all these parts of the Belgian best practice and suicide prevention is just small part of the reform, but very, very important. The most important thing is to ensure a patient-centered and human rights approach in the mental health reform in Lithuania. Besides that personal health issues, we also working with the public mental health issues, like fighting the stigma, which is, I would say, also very important thing, because if you won't find the stigma, you won't achieve anything, even in the personal mental health treatment, in suicide prevention, and to general, we want to increase mental health to make it better. And what I would like to say, like advice for all of us, we heard today very good presentation of EU representative, World Health Organization, OECD. So use it. Use to fight inside your country to saying that how important is mental health for all of us is, how important for us to work together and to improve and to achieve the result we all want to achieve. So that would be my message to all of us, including myself. So thank you.
Last but not least, András.
I'm the last one, the last Mohican maybe. So I'm quite a practical guy, so before answering, I will have a strange question for you, for here, to all the panelists and for all the audience. The question is, what is Coca-Cola selling? What is Coca-Cola selling? Selling.
Selling.
Hmm? Maybe. Yeah, feeling and emotion. So Steve Jobs once said, people don't know what they want. But after you show it to them, they will want it and they will desperately want it. So when we create a project and at the end of the process, there might be a huge gap between implementation and realization in the everyday life for the everyday people at local, country level, countryside level. For instance, in Hungary, most of the people don't care about fancy words like mental health and improvement in mental health, the quality of way of life. They care about what is with my job? How can I prevent my son's suicide? What can I do for better sleep? No big words, just concrete, definite, and everyday words in special countries. I think so. Our biggest challenge here in Hungary to translate the implementation to the realization level, to the everyday people. We have many best practices. We have many good results, evidence-based data. But how can I tell the end user? Is there anyone in this room for the end users and from the patients and from the everyday people we're working for? Here? No. We're just here. We're just here, just experts and talking with ourselves. So our next step, to extend the implementation to everyday realization. I think this is the most important thing. Thank you.
Thank you. Thank you very much for your contribution, and I give the floor to Basileia for closing the session.
I think every one of us contributes in a different way and gives a piece of a puzzle, but all of us can complete the puzzle. So I wish all of the groups, all of the levels to work together on implementation of the project, not as a project, but as a contribution to the health of the people. Thank you. Well, it was a long 3 days. We are not finished yet. Let's have a picture. I think that's what the photographer says. But I'm coming in front. One moment. Slodan, thank you. Slodan? Thank you.